Hi, Courtney. How are you?
I'm good. Thank you for coming.
Oh, my pleasure. This must be Baxter.
It is.
Oh, Baxter, you're so beautiful. So Baxter has a bit of a problem with one of his legs. Yeah, so you've noticed him being quite lame on it?
Very, very lame. Limping quite a lot, very unsteady. Baxter's limited with stairs. He cannot get up or down. He eats lying down. He does wobble a bit and his leg can give way. When he runs or walks, there is a definite limp.
Okay. All right, and it's been like that since he's actually come into care?
Yes. He was injured as a pup. And he unfortunately didn't get any vet attention at the time.
My blood is boiling. I am so heartbroken and so upset to know about his history, that it's not something that happened yesterday. It's been going on for years. It's absolutely shocking to me, and my heart's broken to a million pieces just hearing this. I can actually see that he's limping quite a bit already, just from his standing up and how you're moving around.
All right, shall we have a look at you?
Good boy. Yeah, you're not happy with that at all. He's got quite a bit of muscle wasting on those hind legs. So there's definitely an abnormality between the left and the right, just sort of halfway up his femur. He's got this huge mass. It's almost like a hard lump, and it just does not feel normal at all in there. Having a feel of Baxter, I can definitely tell he's in a lot of pain. He might have a really terrible fracture or break. He might have torn a ligament. There could be something catastrophic going on with that leg. I think we need to find out what's going on inside. So what we'll do is we'll pop into hospital, get some x-rays done, and hopefully get to the bottom of it.
Great. I'm extremely upset and heartbroken for Baxter because it's been so long. I'm really worried that nothing can be done now.
All right, Baxter, let's get that leg x-rayed.
Doctors are going to fix that leg up for you, hey? You're a good boy. We'll get you all better.
My fear is that it might be too late, that we're dealing with an injury that can't be fixed, which means that Baxter would be living with this disability long term. He'll be in chronic pain, and that's going to really limit his chances of adoption. This is Dash.
On the Gold Coast, 3-year-old whipper Dash has been rushed into Alex after he ate an entire bag of chocolate.
Sweetheart, what are you thinking, hey?
Owners Amy and Michael became instantly alarmed when Dash suddenly became extremely unwell.
All right, let's get you over here.
I was upstairs in the study and Dash projectile vomited all over me and the floor before I found the fully eaten packet of dark chocolate and mint protein balls. He was limp, not able to move, foaming at the mouth and like trembling, laying on the floor. But when I noticed the chocolate balls, like my stomach instantly just dropped.
So this boy has eaten a whole pack of dark chocolate, but he's also had a collapse episode associated with it, so just want to have a listen to his heart. Chocolate contains a compound called theobromine, which is a little bit like caffeine, and dogs are very sensitive to it. So if they ingest chocolate, they start to show signs that you'd expect to see if a human drank 10 Red Bulls. For a dog of Dash's size, I'd expect his heart rate to be somewhere between 80 to 120. Heart rate's about 210.
Wow.
Alex is extremely worried. Dash's heart is racing at over 200 beats a minute.
And that means his heart is in overdrive. Good boy. You're all right, my friend.
Hi, how are you, Jeff?
Alison, how are you?
Good, thank you.
Good.
This is
So-
Baxter.
Hey, Baxter, I've
He's
heard a
here
lot
today.
about this fella.
In Brisbane, Alison has brought Baxter to veterinary surgeon Jeff to see if anything can be done to fix the brave collie's chronic leg injury.
Yeah, he's definitely got a really big swelling mid-femur, doesn't he?
yeah.
I mean, it feels like probably a previous break, but we're going to need to go to X-ray.
So Baxter's a little bit of a sad story. He was recently surrendered to Happy Tails Rescue, and he's been through several homes. Unfortunately, there was a bit of an issue and he was injured by one of the owners.
Yeah.
And he's probably had this injury there for about 4 years. So it's quite long-standing. I'm absolutely amazed how Baxter is still so happy and trusting, and he's had the worst thing ever done to him as a puppy. And it makes me want to fight for him more. Really just heartbreaking to know he's been in this much pain for all that time. Yeah.
Well, he's such a happy character. I think if we can get rid of the pain and fix him, he'll get a home and
He will definitely get a home. I mean, his temperament is just gorgeous considering what he's been through.
He's totally trusting.
Look at him.
Hey, you big smooch.
Oh, I love that face.
You big smooch. Come on, let's go fix you up. We'll get an X-ray and just see what we think can be done.
Jeff and I have felt this horrendous lump on his leg. I'm actually really terrified about what we're going to see on Baxter's X-ray.
Okay, Baxter, let's see what you've got going on in there.
Oh my God.
Oh, that is nasty.
That is.
This poor guy has been through serious trauma.
What's amazing is, despite the fact that he's getting around and he's being brave, the leg is snapped right in the middle, like a blunt force trauma or a kick.
I just don't understand how this dog's walking.
Yeah, it's amazing. So it would have been chronically painful. Despite his beautiful nature, he's hiding a bit of a beast in there. He's been traumatised, he's been treated badly, he's just curled up in a ball and self-healed. But it would have taken months.
Yeah.
And months full of agony.
I'm so close to tears right now. That X-ray is absolutely horrendous. It's one of the worst fractures that I've ever seen. And for him to be going through this for so long, he's such a beautiful, brave dog.
How on earth does that heal?
The damage is so severe, surgery now looks unlikely.
So the concern is if we get in there and it's a ball of bone, it'll be very hard to get all that extricated without doing more damage.
The brave collie could be facing a future with a lifelong disability and little chance of adoption.
It's possible, but it's also possible we won't be able to fix this.
Oh gosh.
Yeah, I'm pretty worried that he's had possibly a toxic dose.
On the Gold Coast, Alex is urgently treating 3-year-old Dash after the whippet ate a large amount of chocolate, which is highly toxic for dogs.
And it's dark chocolate. Mate, that's the worst one you can eat.
Hey, you're a silly boy. You're a silly boy. All right, mate. He's really twitchy as well. Good man, you're a brave boy. There we go, we gotcha. I think your mum is very worried about you right now.
I think she has good reason to be worried about you right now.
Yeah.
Alex needs to try to get the chocolate out of Dash's system as quickly as possible.
We know that according to this calculator, he's sitting in the area where we should be seeing heart abnormalities, which we are, so we're seeing a very fast heart rate, but definitely in a danger zone and definitely something that needs urgent treatment. What I'm going to do is just rub one of these little tablets on his gums. It's going to make him feel pretty sick, and we're hoping within a couple of minutes he'll start to bring some of that chocolate back up. Yucky, yucky. I'm just going to give him a whole tablet. Okay. I want to be pretty sure.
Make sure it comes up.
Yeah. Oh, good boy, Dash. Okay.
Sorry, we're going to get it all up.
All right.
Let's hope it comes up.
It isn't long before the drug, apomorphine, starts to take effect.
Oh, good boy. Good boy.
Smell the cocoa on that.
But Dash isn't out of danger yet.
Now we need to attach ECG leads, which will allow us to monitor the rhythm of his heart. I know, you can feel it literally beating out of his chest.
It's okay.
Good boy. His heart rate's just 260 now, and it's real because I can feel his pulses. All right, mate. Good boy. It looks like it's just a tachycardia rather than a tachyarrhythmia, so we need to get this urinary catheter in, and because of what I suspect is happening is he's reabsorbing it into his system via the bladder, so we need to remove that urine. Yeah, that side. Yep, legs towards you. Yep, okay. All right, so before we even try to place this urinary catheter, I'm going to give him some additional sedation because he'll get even more stressed with us putting the UCath in, and at this stage his heart rate is so fast he's in danger of actually having a heart attack. Hey, my man. Hey, there's just a lot going on. Yeah, he's just going to stress himself out.
the bone is snapped and then healed, overridden. So this leg, it's 4 centimetres shorter than the other leg.
In Brisbane, Alison and veterinary surgeon Jeff are trying to decide if rescue dog Baxter should undergo surgery that could change his life.
It's actually the lump that we're feeling is that end of the burn actually piercing through that muscle.
Yeah, and that's the concern.
Jeff's worried he could do more harm than good trying to repair a smashed leg bone the 4-year-old collie received when he was just a puppy.
I mean, if we can get this right, it'll change his next decade, because assuming he's around for another 10, 12 years.
We need to fix him. I mean, this dog is just a miracle
beautiful.
dog. He'll get a home. You know, we just need to get this sorted, get him pain-free. We've got to do everything we can. We might be able to get in there and do something about it. There's a small chance. It's going to be tricky. We won't know till we get in.
If we get in there and I don't think that we can really make a difference, then we'll back away. We'll just walk away, do no harm.
Surgery will go ahead, but with extreme caution.
I want to be 100% sure we can help him. His knee's rotated the wrong way. The leg's extremely short compared to his healthy left leg. It's a bit like a box of chocolates. We don't quite know what we've got till we get in there. But we wouldn't be here if we didn't really believe in our hearts that we're doing the right thing. So hopefully when he wakes up, he's got a leg that's 4 centimetres longer.
Fingers crossed.
Just working out the best approach because all the anatomy has changed. We're just trying to unravel the mess of scar tissue and bone and tissue without damaging any vital structures, because he's tried to heal a broken leg without any help. We've got a really complicated repair that his little body has done. The only thing that he's been walking on has been a ball of scar tissue. So I don't know how he's so happy, but B, how he's walking on this. Like, that's just...
How do you wait there on that?
It should be impossible.
I'm a mess of emotions right now. I'm holding back tears. I'm angry. I'm sad. The force of impact to cause this sort of injury in a young pup must have been horrific. I'm extremely shocked.
It's abnormal, isn't it? Horrible. Oh boy, his muscle structure is so hammered.
Alison and Jeff are desperately hoping they can try to mend Baxter's mangled leg. But the possibility is starting to look extremely grim.
No, it's not coming off, is it?
On an extremely wet day in Bondi, Kate suddenly gets an urgent call for help.
Hello?
There's a possum outside and it looks like there's something wrong with it.
Okay, well let's go and catch it, shall we? Is it nearby?
Yeah.
Okay, let me go and get the towel.
Okay.
This little kid runs in from nowhere and he's like, possum, the possum needs help. And I have no idea what he's talking about, but my first instinct is I'll just follow him. It's gonna ruin my hair. And I'm taking Izzy. Okay, let's do it. Great, it's like cyclone weather.
If the possum is sick or injured, it will stand little chance in the heavy rain.
My goodness, it's like a river. The weather today can only be described as cyclonic, like next level raining.
Oh no, there's a possum. He's been running from here. He's underneath the cars, but he's just sitting in this tree. I don't know what's wrong with him.
Okay. The likelihood of us finding a possum in the middle of the street in the middle of the day is near impossible. God, these guys are nocturnal. They don't come out in the day.
It looked like he went in there.
He was in there and he was hiding behind the rubbish bin.
And then he came out
jumped
and then
in
it
the
looked like
tree.
he climbed back into there. Then now I don't know where he is.
Okay.
He's been here all day.
Okay. Just wait till he moves. Can't see any movement. The rain is absolutely torrential. The light is becoming super dim. I'm so conscious of the fact that we're losing light. Let me go stuff around here. And I'm thinking, we're never gonna find this. Oh, there he is, I found him. And out of nowhere, I see this little tiny thing on the ground. Hey buddy, oh, he's a little ringtail possum. Hey sweetheart, is this the baby?
No, that's not him. There's another one, a much bigger one.
This is here, this is a little baby.
Oh, that's
Oh, sweetheart. Okay, we've got one, but there's others. There's a big one. Oh, sweetheart. So he's just a little baby. I don't know that he's going to survive, guys. He's looking like he's really cold and he's really wet.
He's too late. This is too late for him. I'm not going to be able to save him. He's just cold and he's shivering and he's shaking.
He looks like he's probably got hypothermia. I don't know if he's going to make it, honestly. He looks like he's trying to not live.
This is going to be a long, slow process.
In Brisbane, Alison and Jeff are still trying to decide if they can fix 4-year-old collie Baxter's shattered thigh bone.
So the fracture's under there. It's hard to feel the bone there.
Oh, yeah.
The rescue dog's leg was broken almost 4 years ago, but was never treated.
I'm just absolutely shocked in how bad this is. He really was just weight bearing on a ball of scar tissue. The amount of pain this dog must have been in, just unbelievable.
We've got a complicated repair his body has done with some big changes to the anatomy.
It's just not normal looking bone, is
it's
it?
abnormal, isn't it? Horrible.
Baxter's leg break was so severe and so long ago, Jeff is now facing a painstaking process to try to untangle a badly healed mass of bone, tissue and muscle.
We're going to have to get nasty, Alison. Oh, no, that seems harsh. Look at that, that's moving, independent of the bottom fragment.
When they eventually reach bone, Jeff and Alison make the startling discovery that Baxter's fractured femur is still broken.
I'm now getting movement between the two bone ends. It should be impossible for him to put weight on this. Like, it would be like walking on a broken leg. I think it's a miracle that he hasn't severed an artery or damaged a nerve. There we go. Okay, we've got some normal bone here. Awesome.
Then finally,
we're getting somewhere, Alison.
A breakthrough.
I think it's possible, so it's well worth us trying to do this. We've got two beautiful bone ends. We can definitely trim the edges down to fresh bone, get it together, and then put a titanium plate along the outside. The second screw in. Things are going really well for him, so I'm thrilled. We've lengthened his leg by about 3.5 centimetres. That's beautiful.
Yay! Oh, wow, that's well aligned as well. I couldn't be happier with how today went. Baxter's incredibly brave. He's been brave from the moment that I met him. He has to learn how to walk on 4 legs again. So Baxter has a very, very long road to recovery. He's gained an extra 3 to 4 centimetres in his leg length. So when he wakes up, he's going to feel different.
The surgery went really well. You have that leg back.
I'm so proud of him. There's so many people that love him, and the best case would be he gets a lovely home with an owner that knows about his injuries and just helps him along the way with the rehab. So, very pleased.
So from now, it's a long road of recovery ahead, but you're gonna smash it, I know it.
I know, you can feel it literally beating out of his chest. Good boy.
On the Gold Coast, a chocolate binge has left young whipper Dash with a racing heart and in danger of suffering a heart attack.
Chocolate is just so bad. They just can't metabolise the caffeine and the theobromine in the same way that we can. All right, matey, good boy. It releases additional adrenaline in their system. It acts on the central nervous system, and they just really can crash very quickly at the levels of chocolate that Dash has had. Hey Dash, you've given us all a big scare. Oh, my boy, come on. Yeah, that's it. Hey, you just chill there. The methylxanthines, which are the toxic components of chocolate, they are excreted into the urine, but they're then reabsorbed via the bladder wall back into the system. So we need to stop that cycle from happening by removing the urine as it's produced, and the best way to do that is to put a urinary catheter in.
I know, good man.
We've just got to be really careful while we place it, not to tip him over the edge.
Good boy.
All right, Dash, hang in there, mate. Okay, oh yeah, as we place the urinary catheter, Dash's heart rate actually starts to go up. And that's because his fight or flight hormones, like adrenaline, are now running through his system and adding to the pressure on his heart. We're just going to empty this urine out of his bladder now. Again, that's just going to help get these toxic components of the chocolate out of his system. So it's all about decontamination at this stage. All right, let's just get his legs my way.
Good boy, you're going to fall in a minute. It's okay. Good boy. You're giving us all a scare, aren't you?
You know, he's in a lot of danger at the moment, and I've certainly seen dogs this bad with chocolate toxicity just die. So we really have to monitor him continuously. Thanks, Patrice. Hey guys, this is Dash. He's in a bit of trouble. Come on, my friend. Good boy.
The next 8 hours will be critical, and Dash will be closely monitored for any signs of deterioration.
Good boy. Good boy.
Wow, she is so pretty, isn't she? Yeah. Hey?
In Isleworth, London, a little dog called Luna urgently needs Scott's help.
She's 3, so we've had her since she was a puppy. But she's just absolutely crazy. She has such a high prey drive that she just runs after squirrels.
Owners Ben and Alice rushed Luna into Scott after she suffered a shocking injury at the park.
Luna was on a walk and we heard a lot of yelping while she was chasing the squirrels. She has completely ripped her leg open.
It's a pretty nasty wound, so we've just put a dressing on it.
Yeah.
I'm just taking it off now to show you.
Okay. Was she missing for a long period of time, or?
No, just out of sight for a couple of minutes.
The nurses have already seen the wound.
Prepare yourself.
Really?
Yeah.
Oh my God. Oh my God. Looking at this beautiful Cocker Spaniel, I'm horrified. Luna, what's happened? Oh, I tell you what, I'm glad you're wearing that, because you don't want to see what's happening back here. I literally have never seen anything like this before. It looks like she's been bitten by a shark.
Well done.
Oh, honey, I'm sorry. It wasn't me. It wasn't me. That is grim, isn't it? That is out of a horror film.
Although Luna's been given a pain-relieving patch, removing the temporary dressing is excruciating.
What a brave little dog Luna is. She's holding it together well, but it does look like she's been skinned alive. And of course she'd be in a huge amount of pain and in shock, but she's being a very brave little dog. It's so brave. Oh, you're still wagging your tail. Oh, you're a good girl.
He looks like he's probably got hypothermia. I don't know if he's going to make it, honestly.
In shocking Bondi weather, Kate has just rescued a baby possum, but the tiny ringtail is close to death.
Come on, let's get him back to the clinic. That's the first thing. Get him really warm and then get him some fluids. Yeah.
The baby possum is hypothermic, and that means that his body temperature is too low to sustain life.
Okay, bye.
It is really important that we get him warm, and we get him warm really quickly.
While Kate's team start to take care of the baby, Kate now urgently needs to locate its mother.
I have no idea where she is. Could be anywhere. She's going to be really distressed. She's not going to have a baby, so where's she going to hide and where's she going to go? So I got to look for some movement. It's the only way to find these guys.
I am so determined to find this mum.
Where are you, Mum?
I mean, I just feel for her because I think she's been running around like a crazy possum looking for her baby.
Okay. Is that Mum up there, do you think?
As I'm hunting and I'm searching every tree, I spot this little possum box. I just know, I have this feeling that she's in there.
We've got to focus on now trying to save this baby, right? So at least if we can do one thing good, it will be to save the baby.
Hey, don't get hit by a car, Izzy. I'm so cold and I'm so wet. I'm so happy to get out of this rain, even just for 1 second. Oh, look. Oh, he's in a little sock.
He's in a little sock.
Is he all right?
Yeah, he's just cold.
All of my girls have put in such a mammoth effort to keep this little baby alive. And there he is in this little sock, snug as a bug in a rug. This is our makeshift pouch called a sock.
The possum is safe and slowly getting warm, but every minute is critical to see if he will survive.
God, that is grim, isn't it? That is out of a horror film. Oh, honey, I'm sorry, it wasn't me.
In London, Luna has been urgently rushed into Scott. The little dog somehow ripped her leg open when she ran off from her owners during a walk.
Have you ever seen anything like that in your career?
No, it's massive. Yeah.
All right, well, we've certainly got our work cut out fixing that then, ladies. I think let's give her an anaesthetic and let's put her out of her discomfort for the short term and let's try and fix that unbelievable wound.
It can't be underestimated just how serious Luna's injuries are and how life-threatening they could be.
Oh my God, look at that. I tell you what, she is so lucky. See just there's the femoral artery and you can see it pumping, look. If she had caught that, then she wouldn't be here now, there's no doubt. Luckily, we do have quite a bit of skin to play with here, so I think that we should be able to sort this out. All right, well, should we start just giving her a bit of a clip and a clean, and let's get her into surgery, shall we? It really is incredibly upsetting to see a dog in so much pain and discomfort, and all from just a casual walk in the park. We've got to remember as well, she has some really distressed owners too.
You were saying it was more just the screaming from her because she was in so much pain. And you just said every time you shut your eyes is all you could think about, wasn't it?
It was quite traumatic, you know, for something that you love that much, to be in that much pain.
I mean, it is massive.
Yeah.
You know, if you think of the actual size of the dog, I mean, that hole's about the size of her head. My job now is to understand, is there any skin missing? If there is skin missing, then I'll need to find skin from somewhere else. And the way that I'll do that is by doing a flap, which we extend over the wound itself. So it's a big job. Looking at this horrifying wound, I really can't say if Luna will pull through because it's massive. And I don't know what kind of injuries might have occurred underneath. So all I can do is try and close this horrendous wound and hope that this little girl makes a full recovery. This is really helpful, actually. Yeah, there is a moment when you're doing a surgery like this where you do go.
Hi, Courtney.
Hi, Baxter. Hi, Darcy. How are you?
Look at that leg, the hair's grown back almost.
I know, he's doing amazing.
It's 3 months since Baxter's successful surgery to repair a severely broken rear leg.
I can see he's using the leg.
He's using it really, really well. He's far less wobbly.
Alison has arrived for a rehab session with the friendly 4-year-old, who's recovering well under the watchful eye of adoring foster carer Courtney and her son Darcy.
You feel like he's still in pain? Has there been any improvement?
I've seen a massive improvement in his pain. He's now seeking out to play with whoever he will play with, especially Darcy.
Baxter looks like he's recovered really well from the surgery. He's walking really well on that back leg. He's back to his normal self. He's really happy and confident. I don't want him to fall over. Oh, thank you. You are the best helper. Look at all this love you're getting, hey? I wasn't able to even touch this leg last time. The fact he's letting me even extend and flex each joint is amazing.
Next, Alison sets up an obstacle course to test how well Baxter is using his refurbished leg.
All right, do you want to slowly walk him over? Yeah, so he hit that one. He cleared that one. He manages to clear some of them, but he doesn't lift it high enough, so he actually taps it or pushes it over. But he's not doing bad at all. I don't think I've met a dog quite like Baxter. He's gone from a dog that's been completely lame with the most horrendous fracture to a dog that's walking normally, is really happy, is really healthy. I'm very confident that Baxter will find an amazing family that will love him, and I'm really sure he's going to have a really bright and happy future.
Good boy.
While the search begins for a new home for Baxter, Courtney and Darcy are making sure this extra special boy gets heaps of love.
What's that? What about the peanut butter?
Darcy and Baxter have an amazing bond from the moment they wake up to the moment they go to bed. They are together, on top of each other, next to each other. Darcy is absolutely in love.
Okay, Baxter, we will see you next time. He's doing so well. I'm sure he's just going to go from strength to strength. And I really, really hope that you get adopted soon.
Yeah.
He is just the best dog.
Isn't he? We think so.
You do your exercises.
Bye.
Bye. See ya. Bye, Baxter.
I tell you what, she's so lucky. See, just there's the femoral artery. You can see it pumping, look. If she had caught that, then she wouldn't be here now.
In London, Scott still can't quite believe just how badly little Luna has injured herself after running off during a walk. He now has to try to repair the shocking wound in Luna's leg.
What I'm doing is tacking. So I'm basically putting tension is underneath the superficial layer, the epidermis, to try and encourage it all to come back together. So it's just a little time consuming, but actually one good thing about it is that all this tissue is nice and healthy. So it looks very red and very angry, it's bleeding, but that's good because it means it's got good blood supply and it's almost certain to heal very well. And that's that.
Amazing.
Oh.
It's a lot of stitching.
1 million stitches, yeah. So I've just finished the procedure on Luna and it's very rewarding. So we now have a dog that has skin covering her from top to bottom, which is the way nature intended. And she's gonna wake up and recover and grow back fur, and you'll never know that this horrific injury had ever happened.
Oh, he's in a little sock.
He's been hair dried and he's just getting warm.
Oh, this is nice and warm.
On a freezing wet day in Bondi, Kate and her team are desperately hoping they've rescued a tiny possum in time to save him from hypothermia.
This is a little ringtail possum. You can't really see in him at the moment, but he's got a little ring to his tail. Ringtail possums are these gorgeous little marsupials. They've got these strong tails with these curled up, like almost like a ring, right? And it's always in a ring, so you can tell a ringtail from quite a while away just by their tails. Well, it looks like at least he's not injured, right? So it just sounds like as though he's cold and he's wet. I thought he was dead, but it turns out right here has helped keep him alive, so that is good. Ideally, I could find the mum so I can put them back together. Okay, you ready?
Kate is going to make another attempt to locate the baby's mum.
We've got to do it before it gets dark. Once it's dark, we've got no hope. Let's go. If we don't find mum, this little baby possum has less of a chance of living as an orphan than he does of having a parent. Okay, she's got to be around here somewhere.
In Isleworth, Luna's ready to be reunited with her incredibly relieved owners.
Here's your baby. So I'm just going to gently pop. I know, that's mum and dad, isn't it? Here we go. Oh, that's a nice wagging tail. It's so incredibly rewarding to be able to reunite Luna with her loving owners. But certainly this is not a day that they'll want to remember. Love you, Daddy, don't you? You've done an amazing job.
Oh, thank you. I just can't believe she's wagging her tail. You're so sweet. It never ceases to amaze me how resilient and brave animals are. And look at Luna, the tail's wagging and she can't wait to get home. Take care. Bye, sweetheart.
Hey, Dash. Look at you. You're asleep. Hey? Well, you look very different from yesterday.
On the Gold Coast, young whipper Dash has made a remarkable recovery from a dangerously accelerated heart rate after eating a large amount of highly toxic chocolate.
Last night when I left him, his heart rate was still really high. He was very agitated from the effects of the chocolate. This morning, he's got it out of his system and he's pretty exhausted, to be honest. His body's been through a lot, but he's going to be okay.
I know some people are going to be very excited to see you.
Owners Amy and Michael are eager to see their special boy, and they've brought along his equally excited housemate, Daisy.
Here you go, me boy.
Dash's owners didn't know if he was even going to survive yesterday, so to be able to reunite them with him today, that's incredible.
In here. Hey.
Oh, you look fancy.
Look, he's here.
Hey, how are you?
Hey, is that your friend? Oh, I know. Yeah, I know. Oh, it's okay. Just be gentle. He's been very sick, your brother.
Hey, you won't be doing that again, will you? You always see on TV and what chocolate can do to your dog, and you don't really think it is severe as what they say until you see it. It's not something that I want to see my dog go through again.
Yeah, we missed him on his walk today.
Oh, that's awesome, guys. He definitely had me worried yesterday, but...
He had all of us worried.
Yep. I told him, no more chocolate. It's good, but it's not good for you. Yeah. Dogs love chocolate just as much as we do. So accidents are going to happen. The important thing is to get them to help as quickly as possible. That's our best chance of saving a life.
Good little fella, you're safe now.
A tiny rescue possum is clinging to life.
I'm just going to go check this tree. Mum's got to be around here somewhere.
While Kate and her team are braving torrential rain to make another attempt to locate her.
Okay, well, there's like a box up in this tree. I have no proof of this, but I swear that she is in that possum box. And then just as we're like debating how to get her out of the box thing,
Where is she?
she just runs out of the box. And then all of a sudden she sees us all and then just makes a run for it. So now we're back to square one. I think we're in a position where we basically just now have to wait until the baby's well enough that we can put the baby back somewhere and hopefully that she finds it. Oh my God, it's so warm here. Holy moly, I thought you were dead, little guy. I thought you were a goner. Look at you.
Inside, the baby possum has made a remarkable recovery.
I think we should call him Peter.
Peter?
Peter the possum. Honestly, he is getting better by the second. Like right in front of my eyes, I see this little possum like just come to life. It's just magical. It's a really, really good moment. It's a good moment for everybody. He wants to live. He needs some food. After Peter is feeling better, it's really important now that we call wires so we can get a carer to come and collect him. These guys are absolutely amazing and I just know that they're gonna do an absolutely brilliant job in looking after Peter.
Oh, hello. Oh, sweetheart, hey.
And he's a good little guy. His name's Peter.
Carer Ilona is delighted to meet courageous little Peter.
So he's good, he's like nice and robust.
Yeah, get the pouch and take him home and bring him back in a few days.
Yep.
Reuniting with his mum. That'd be amazing.
This was a perfect outcome. It would have been better if we could have caught the mum and we could have reunited them, but that was probably asking a little bit too much. We found the baby, we rescued the baby, a baby that was on the brink of death, and he has gone to a carer and he's going to be okay. Look after him, hey?
6 weeks after her operation, Luna has made a remarkable recovery from that shocking leg wound. Her injury has healed so well, she's even back enjoying walks, with relieved owners Ben and Alice keeping a close watch on their precious little girl.
Once the final bit was sewed up and, you know, she started to run around again and almost be unfazed by what had happened, we were surprised about that.
Yeah.
No fear, still wanting to chase the squirrels.
And the birds.
And the birds. And the swans.
Hi! Yeah!
And great news for brave Baxter. A family is ready to adopt the courageous collie.
Does he like kisses?
Yeah.
Wow.
As soon as Baxter's leg has fully healed, he'll be the centre of attention in a loving new home.
Once Baxter's ready to go to his new forever family, Darcy will be upset like I will be, but it's been a pleasure and we'll love him forever and hopefully we get updates.
And good news for Peter the possum, who is reunited with his mother the next day.
Oh, he's so hungry.
When she gets a good bit of momentum, she's got heaps of rotation and thoracolumbar spine as well.
That hip will start to wear properly. I worry about her knee and her ankle though.
In Sydney, Audrey is catching up with good friend Matt, who wants her advice about his beloved Rottweiler, Sunday.
Her only saving grace is that she does so much swimming that she's well muscled. Alrighty, good girl. A lady messaged us on Instagram and said, I've got a dog that's missing a leg. So she shows up with this beautiful Rottweiler puppy, and I looked at it and I just thought, this dog's going to change my life. But you can kind of see she's got less muscle on that left leg with a little nubby.
Yeah.
Sunday was born with 4 legs, but on the second day of her life, she needed to have her back left foot cut off, just below her ankle. I don't know the story why. I think a few of the puppies in the litter didn't make it. She was lucky that that's all that happened to her.
How's she going?
Yeah, she's going pretty good. Starting to show a little bit of lameness and limping, and you can tell she's getting a bit sore on it.
Sunday's so important to Matt, and you can see their amazing relationship and bond.
Do you want to party again?
We're a little bit worried because she's starting to struggle just walking on 3 legs.
Come on, sweetie.
In the past, we've managed her with external prosthesis, but that's obviously uncomfortable for her, and she's not really liking having that attached to her leg.
Today, Sunday is walking without her prosthetic foot, so Audrey can gauge how the 3-year-old copes with her disability.
She can see that she's sort of curving around in an unusual way and just kind of bending that right leg to compensate.
Yeah, she's a beautiful dog and I love her, and I just want to see her have a really good quality of life, so I'd love to see what you think and what can be done.
So it'd be interesting to kind of see her in the rehab clinic.
Come on, hey.
After observing Sunday outdoors, Audrey is now keen to get a more scientific analysis of how she walks.
Come on, in this room. What I do at the animal rehab clinic, the way you should think about it, it's kind of like a physio clinic for animals. So anything that a human might go to a chiro or a physio or a massage therapist for, that's the kind of stuff that we do. Up you get.
Good girl.
Stay.
Good girl, son. Stay.
Wait.
Stay.
Matt is a trained chiropractor, but swapped treating humans to co-found one of the world's few rehab facilities exclusively for animals.
Good girl. Good girl. Matt has had Sunday since she was only a puppy and seen her grow, and he's been amazing with her rehab. Clever girl.
Audrey will put Sunday through an extensive testing program before advising Matt on whether Sunday's damaged leg can be saved.
Good girl. Good girl.
I've done every single thing that is possibly available, and even a little bit experimental, to give her the best chance at having a good quality of life. She's my kid, and I want to do everything I can.
I think we both kind of know we leave it any longer, she's going to start coming into problems.
Good girl, Pachacha. Good girl.
Ooh, there we go. Good there.
Hi there, Karen.
At Scott's UK clinic, Karen has arrived with her beloved companion, Lily.
How's she doing?
She's doing very well, a bit apprehensive, a bit nervous as always.
Yes, she's always very sweet and saying hi to me.
Today, Lily will have an operation to check out a growth on her bladder to see whether it's benign or malignant and whether it can be removed.
There's an Aussie word that I know from home. It's battlers, as in like the great Aussie battler. And it means people that are strong and they're brave and they're committed. And that's exactly what both Karen and Lily are. They're battlers.
Lily is my best friend. She's my confidant. She's the child that I've never had. There.
2 years ago, Scott removed a tumour from Lily's mammary tissue. This time it's feared the elderly dog has a suspected growth in her bladder. At the same time, Karen is also undergoing treatment for breast cancer.
Shall we throw it for you? Shall we throw it for you? Just a little. It's so important to have a reason to get out of bed when life deals you a few curveballs, and she's that reason.
All right, honey, you're not going home. You're coming with me. Say bye to Mummy.
Come on, you're going this way.
Come on then.
I admire Karen so much. She has a heart of pure gold. And here she is, diagnosed for a second time with breast cancer in a global pandemic. And now her beloved Lily is facing another scare. It's just heartbreaking.
Come on then. Hi, guys. Hi. Lily, I think you both know her. Come here, gorgeous. Oh. So it's a nervous day, not only for her, but for her mum, as you know. And now we think there's a big chance that Lily has also got a bladder tumour. We're going to ultrasound the bladder again, just to see how the mass is looking. X-ray to see if there's any spread of any cancer. And hopefully if there isn't, then we're going to go in and we're going to see if we can remove that pesky tumour, aren't we? Yeah. She's so beautiful, isn't she, don't you think? A little tongue, yeah. Little tongue.
But as the team begins prepping Lily, Scott makes an alarming discovery.
Oh, goodness. I just noticed that.
Do you think that's coming from the abdomen?
I don't like it. I don't like it at all.
Clever girl. You're clever.
At a rehab clinic for animals, Audrey is running tests on 3-year-old Rottweiler Sunday's damaged leg.
Good girl.
The clinic's founder Matt adopted Sunday after her rear left foot was amputated when she was just 2 days old.
I was lucky that she found me rather than the other way around. So it was just fate or luck or good timing or whatever it might be. But I'm very glad that she's in my life.
Good girl. We'll give you treaties afterwards, okay?
After a stint on the treadmill without a walking aid,
Alrighty, up.
All right, up.
Sunday now has a prosthetic foot attached, so Audrey can analyse any differences in her gait.
She's using it, which is good. That right back leg actually looks very good. It's nice and straight and she's really extending that knee, and then she's losing that curve in her back as well. So it looks almost like she's walking normally on her good leg. I'd love to see her in the water bath.
Okay, well, are you ready for a swim?
Next, Audrey will test Sunday to see how well her legs work in water.
She's actually kicking that back leg as if it was a full leg.
Yeah, she does swimming 3 or 4 times a week.
And that's probably what's just keeping her muscle mass. Look at you, darling. You enjoy your swims? Sunday is a nice young dog. She's really, really healthy with all the exercise she's been getting. What's also encouraging to see is that her spine's actually sitting straight. So that tells me that if she is allowed to use all 4 legs at the same length, she actually walks normally. How are you feeling about surgical options at this stage for her to try and help her walk a bit more normally?
Yeah, it's scary.
Something needs to be done. We've tried those external prosthetics. Osseointegration surgery is a new type of surgery. It's been done plenty of times in humans, but not much on animals. So instead of using an external prosthesis, which provides a lot of discomfort, using something internally where we screw it into the bone should hopefully provide her more comfort, get her using that leg properly again.
There's no easy road out of this. We do nothing and she progressively degenerates with the hip and the knee, or we do something and hopefully it goes well, and it might not. So it's scary.
Yeah. Surgery like this is really tricky for any owner, especially Matt, because he has such a strong bond with Sunday. I really feel for him, because if this was my child or my dog, it kind of tears at the heartstrings. You don't know what the right decision is.
I've kind of resolved to the thought that to give her the best chance at a good quality of life for however many years she's with me, I kind of have to go through with this.
Yeah.
This is Lily, I think you both know her. Come here, gorgeous.
In the UK, Scott is about to investigate a suspected tumour in elderly dog Lily's bladder.
Oh, goodness.
But he's just noticed something else very worrying.
Do you think that's coming from the abdomen?
So what we found, unfortunately, is the second mass. The first mass that we knew about is in the bladder. This is a mass on the outside of her body, on her mammary tissue, her breast tissue, and it's right near the spot 2 years ago where I removed her previous breast tumour. So that's quite concerning for me.
Scott is now taking a sample of this new lump to find out exactly what he's dealing with. Next, an increasingly worried Scott is moving to the ultrasound on Lily's bladder, desperately hoping there's no other hidden surprises.
There. Don't say that now. So just whilst I was doing the ultrasound and could see what seems like a mass in the bladder, Sam, my head nurse, was able to find, unfortunately, what seems like another mass further up, sort of underneath her armpit. So just taking a sample of that as well.
Scott needs to do urgent x-rays.
Okay, x-ray. Things keep getting from bad to worse with Lily. Although her chest is clear of any obvious tumours, and as I was turning her, I also found another lump on her back, so that's 3 lumps we've now found. It's going from bad to worse. It's not great, it's not great.
Three-legged dog Sunday has arrived at SASH for a crucial CT scan that could pave the way for life-changing surgery.
You want to sit up on the couch, don't you?
Owner Matt has agreed to revolutionary technology where a permanent prosthesis would be inserted into the 3-year-old's amputated leg.
G'day, Matt.
Hey, Dan. How you doing?
Hello, Sunday. Come on in.
Alrighty.
But first, orthopaedic surgeon Dan has to decide if Sunday is a suitable candidate for the new and risky procedure.
It's interesting watching her walking around here, isn't it? She really wants to use that limb.
So it's like she's constantly got this, trying to touch the floor. I'd say she's trying to kickstart a motorbike.
CT is going to be our best way of knowing where we can potentially put an implant in. Sunday does still have her ankle joint there. It would seem really nice to be able to keep that. The CT will probably give us the information we need for that. Okay, let's get her admitted.
All right.
Osseointegration's a rarely performed procedure. It's been done in small numbers of veterinary patients around the world, but hasn't yet been mastered. Sunday's a patient who we really think can benefit tremendously from this process, but I can't say to Matt, with my hand on my heart, she has a chance of this doing well. There seems to be quite a lot of good bone stock here in her tibia that we should be able to take advantage of. It looks quite nice and straight here, flared at the bottom to stop the implant from moving, and all the things we'd really hope to see here and allow us to move forward with giving Sunday a new foot. Pretty promising.
Super.
Next time we're going to see each other and see Sunday is when we're going ahead with the surgery.
All right, beautiful. Well, thank you very much. Appreciate it.
See you later.
Today's successful scan means the risky surgery can now go ahead.
Come on, Pachacha. Good girl.
This is George.
On the Gold Coast, 7-week-old kitten George has been rushed into Gerardo after his alarmed owners heard him screaming out in pain.
George. George.
Come on, little boy.
Oh,
I
oh,
know.
look at that little meow meow. Hey, mate. Oh, wow.
The baby.
George is tiny.
He's so cute. Look at those eyes.
Shannon and Michael are desperately worried about their precious new little boy.
George was playing with the dog. About 5 seconds outside, he just started screaming. He couldn't put any weight on his leg, so I was just sort of hoping it was a bit of a sprain, but was sort of prepared for it to be a little bit worse.
These little toesies.
Oh, ouch.
Okay, feeling
Good
up
boy.
the leg here.
Good boy. Oh, he's out. Oh, ouch.
Oh, doesn't like that bit there. When I feel around George's back end, he's very painful on his back left leg, possibly around his ankle, maybe around his knee. It's a bit hard to determine. So what I'm going to do is get him some pain relief and take in some x-rays.
Ready, be brave.
Okay, be good, George. Here we go. Here we go.
Good.
Good boy.
Good boy.
Okay, let's pop him back in bed. Make a bed for him.
Yeah, let's go. Go to bed.
X-raying such a tiny animal is always risky, but it's the only way Gerardo can determine if the little kitten has simply sprained his leg or if the injury is something far more serious.
Here we go. I'll get you over the tray.
After a massive build-up,
You gonna be a goodie?
Matt and his beloved Sunday are ready for breakthrough surgery that will give the 3-year-old a brand new leg.
You don't want to get out to your pachacho. This is not a negotiation today, I'm sorry. To me, today was an inevitability, and I am terrified that something will go badly. But I almost feel bound by fate that there's been so many things fall into place. I sort of think this is meant to be. Come on.
COVID restrictions mean an anxious Matt can't be with his adored Rottweiler for the high-risk operation.
Give me a kiss. Good girl.
After a goodbye kiss, Matt hands Sunday over to orthopaedic surgeon Dan.
Sunday, who's that?
Hello, sweetheart. You good girl. G'day, Matt.
Dan, how you doing?
So we've reached the day.
Yes.
How's she doing? Is she all ready to go?
Oh, she's more ready than me.
A lot of anticipation for the big day today and getting the team assembled, all the right people here to really give her the best chance of a good outcome. So plenty of nerves after so much of a build-up.
Oh, I'm gonna miss you, big girl. Hey, kiss.
Oh,
that'll do it. All right,
good girl.
Off you go with Dan.
Okay.
Make sure you bring her back in one piece.
Speak soon.
Thank you.
Okay, come on, Sunday.
I don't think there's an easy way to put someone you care about so much into a risky situation, but there's no going back now.
Once inside, Sunday is sedated and prepped for the historic surgery.
Sunday couldn't possibly know what's ahead of her. Hopefully she's delighted with the outcome and everyone else is too.
Very good. Excellent.
If all goes well, Sunday will be one of the few animals in the world to have a metal implant inserted into an amputated leg.
You happy if we proceed?
Yeah, let's go.
Okay, let's get going.
Dan leads the team, which includes Dr. Munjin, a world expert in human osseointegration surgery.
Gently and delicately. Okay.
It's a delicate and painstaking procedure that works on humans, but is rarely done on animals.
So we need to bore the canal of the tibia to the size that can fit the implant. There is no room for haste here because the bone that we take out can clog and create much more friction, and that can break the tibia. If we shatter the tibia, then there is no chance for inserting the implant.
And if that happens, the whole process will fail and Sunday will be worse off than what we started. I cannot hide that I'm anxious.
Back on the Gold Coast, vet nurses Patrice and Tiffany are preparing George for an X-ray
Boy.
after he was injured during a friendly play with the family dog.
Funny little noise. Good man. Oh, not happy.
Owners Shannon and Michael aren't the only ones shocked by the dramatic turn of events.
Oh, the dog's absolutely devastated. It's been sad all afternoon. Probably just keep them separated for a little bit until George heals up, and then hopefully sort of reintroduce them a bit and teach the dog to be a bit more calm.
She's going to love having George back.
Hey George, it's time for your X-ray, mate.
Everyone is desperately hoping the kitten has just a simple sprain and not something much more serious.
You ready, mate? You're going to be brave.
What's going on?
Gerardo is concerned about the possibility of risky surgery on such a tiny kitten.
I know.
Oh, I hope he doesn't have little brokey legs. The last thing you need is a broken leg, George.
Yeah, I think he agrees. I know, it's not fun, is it?
Wriggly George will need a sedative for the X-ray,
Just a little bit.
but controlling the dosage is critical. Too little and the kitten won't stay still enough, but too much could prove fatal.
He's cheeky.
Let me go. I don't like being held.
Because he's so small, you have to give tiny bits at a time. Otherwise, the risk here is we give him too much. Hey? We don't want to do that. Okay.
You right?
Let's have a little look now.
Little heart's pounding. I might get him some of that oxygen. Put that little...
Okay, got oxygen on him. There we go, George. Good boy.
Put your little head up here.
A little mask for him. Okay, here we go.
Breathe the oxygen.
X-ray. Bio. Look at this.
Oh, look. No wonder it's sore. Poor little fella. No wonder he wasn't happy about you touching that.
No, and no wonder why he doesn't want to use it.
Yeah.
George, you're allowed to be in pain, mate. That is pretty much straight down through the bone. Normally it's only one side.
Oh, yeah.
Yeah, it's a spiral fracture. And the only thing that's keeping that together is his little fibula, a little bone on the side, which is acting like a splint, like his own splint. Poor little matey.
Where's your sore paw? This one? Is this your sore paw?
At Kate's Bondi Veterinary Hospital, Dan has brought in his golden retriever Skippy after the 2-year-old had a painful accident at the beach.
Skip! How are you? You knew it was me, didn't you? Are you good? You're looking good.
Yeah, he's got a sore paw.
It's not very good, is it?
No.
Come on, Skip.
Come on, Skip, let's go.
Always happy to see the vet. Skip.
Oh, he loves coming here.
Super enthusiastic.
Come on, Skip.
Come on, Skip.
Come on, go.
I know golden retrievers and they don't ever show much pain. So this is as much of a limp that you're ever going to get out of a golden retriever.
So Skip has had a limp. I can see as soon as he walked in, he's
Yeah.
got a limp on that left fore.
Yeah, the kids took him for a walk down the beach and he stepped into a rock pool and there was a bit of a broken glass bottle. They got it out, or what they thought was most of it.
Skip, hey, you're the wrong way. This way. Come this way.
Around this way.
This way.
Because of Skippy's size, Kate is going to use an unconventional method to get a close-up look at his injured foot.
1, 2, and 3.
Well done. There we go. But there's a big tummy rub.
Let's have a look at this foot, kid. Which one is it? This one?
Oh, it's okay.
It's okay, don't worry.
I think it's on the pad.
Yeah, you're right. So what he's got here is a nasty gash to this outer paw pad. Doesn't like it. It's very sore. It's okay, don't worry.
I know.
So I can see just from me doing even a little tiny touch that Skippy is going to absolutely crack it if I touch that little wound. So he is an unhappy golden retriever.
So what I'd ideally like to do is actually open it all up and have a look if there's still glass stuck in that
Yeah.
foot. I have a feeling that there probably is.
Yeah, he didn't like it, did he?
I also have this feeling that it's starting to look a little bit infected.
Right.
I need to make sure that if there is even the smallest, tiniest piece of glass in that foot, that we find it and we get it out for him. So what we're going to do with Skip is I'm going to put an IV catheter in.
Is your dad going to leave you here? Yeah.
There is absolutely no point in putting Skip through the stress of having a dig around in this foot without sedating him. You got this, my little friend. He's not being great with getting the catheter in.
Skippy, it's okay, it's okay, it's okay, it's okay.
So we're talking 40 kilos of dog here. Don't do it, Skip, come on. You got this, babe. When Skippy doesn't want to do something, you know, Skippy really doesn't want to do something. We're going to get it this time, Mads. Yep.
It's a scary ordeal for the young dog, and he's so nervous, it's making Kate's job tricky.
It's in. Oh my God. Let's just all calm down.
Okay, X-ray.
In the UK, Scott has discovered a little dog that came in with a suspected bladder tumour also has an additional 2 lumps on her chest and on her back.
The chest is clear of any obvious tumours, but as I was turning her, I also found another lump on her back, so that's 3 lumps we've now found.
Scott's anxious to see the results from the samples taken from the lumps.
So how did that 3rd lump look?
That one looked quite fatty, so when I put the stain on, it completely washed off the side.
Awesome.
But the rhesus just having a look.
Fantastic. Okay, great. Well, so at the moment, I just have to remove the one. The other 2 look fatty. Oh, thank God for that. I can't find any more problems in this dog.
Surgery on Lily's suspected bladder tumour can now get underway.
Whenever we perform a procedure on any animal, there's always risk, but particularly for an old dog. And then you've got an old dog who previously had had cancer, potentially now has bladder cancer, now has a lump that we've found in her mammary tissue. There's quite a lot there to deal with, and none of it I like very much. So what I've got here is Lily's bladder in my hand. Just having a feel now just to see if I can feel any mass. On the outside of the bladder, it actually doesn't look too bad. I'm just about to make an incision into the bladder to see what lies beneath. Because we can anticipate that the mucosa is going to be quite thick. Thankfully, after a series of unfortunate finds, this is not bad. Because I'm thinking that this looks free of tumours. So I think what we were seeing on ultrasound was actually the fat pushing the bladder.
It looks like good news for Lily, with no signs of bladder tumour. But Scott wants to delicately take a sample to be absolutely sure.
It's a tiny little thing there. You can feel it just right at the tip of my finger. It's about a pinhead size. It's way smaller than what we would have imagined.
Yeah, and that's it right on the end.
Yeah.
The sample will be sent off for analysis.
So I'm just in the process of closing the bladder. And the next step is then removing the mammary mass, which was the same issue that she had a couple of years ago. So now we've taken that sample, we will be sending that away to the pathologist and they'll have a little look and just see if it is what we think it is, which is a mast cell tumour.
A mast cell tumour is actually one of the most common types of skin tumours that consist of mast cells, which are a type of white blood cell. Now they're found in all types of body tissues, and most commonly they form like nodes or masses in the skin, but they can also affect areas of the body like the spleen, the liver, the intestine, or even the bone marrow.
So that is that. So really long surgery for little Lily. We've removed one suspect tumour, we've sampled another from her bladder. So now she gets to wake up and then we just have a bit of a wait to see what the pathology shows, and hopefully it's good news for her. All right, let's wake her up.
You did so good. Well done.
Lily will have a big sleep after her marathon surgery before going home with Karen.
Good girl.
It's in. Oh my God.
In Bondi, Kate urgently needs to try to get glass out of young golden retriever Skippy's foot.
Skippy?
But attempts to insert a catheter into the nervous dog are not going well.
Oh God, no, do not. He's got to be a good boy for me for like 1 minute, okay? I know it's really hard for golden retrievers. Please don't do this. I do my absolute best to make the experience for the dogs as stress-free as I possibly can. However, welcome to being a vet. Sometimes stuff happens. Skip, I can't help you if you don't help me, mate. If you pull it out, mate, I can't get it in, and then we can't do this.
Ah, buddy.
Eventually, 45 minutes later, we get a vein. You're feeling tired. Success.
1, 2, 3.
Good job, guys. Sleepy. Let me just move this. Just give it a bit of a clean.
Kate can now finally start the delicate process of trying to see how much glass is in Skippy's painful foot.
In that left fore, I can see a really large gash. My first impression of this is that it's really deep. There's a lot of stuff in here. Oh, it's like glass, all right. That's a problem. It looks like as though that there's glass that's basically gone straight through that foot. No wonder this is so sore. Whoa, shards of glass. How are we going to get all this out?
We just go steadily, slowly into the canal.
In Sydney, orthopaedic surgeon Munjid is cautiously drilling Sunday's leg bone to make way for a revolutionary metal implant.
You have to go very slow. If we shatter the tibia, there is no chance for inserting the implant.
Today's groundbreaking surgery has everyone on edge.
Working on an animal is very different to the human, where the bone is much bigger and we know how much torsional force the human being can tolerate. However, none of us have the experience with how much Sunday's bone will tolerate.
What I will do now, I'll check the position of the borer inside the tibia.
Munjid and his team have finished drilling into Sunday's leg without fracturing the bone.
Table up a bit, yeah, go for it, Alex.
An X-ray will show if the hole they've made is the right fit for Sunday's implant.
This looks very well. The reamer is in a good position. We have some thinning of the bone on one side, but it's in a perfect position. Okay, we reached the final stage.
If something dramatic's going to happen, it's going to happen right now, and we're all a bit nervous about that.
So we need to go gentle and slow in order to insert the implant without fracturing the tibia.
This is the critical step. We've got to the point where we've made the hole in the right spot, but now we're trying to fit an implant. We know that there's not a lot of extra bone left in her tibia after we've dug this big hole. It's a time that we're all going to have a little bit of finger crossing going on.
As the surgical team again worries they could shatter Sunday's leg, her devoted owner Matt is anxious his beloved Rottweiler will come through the risky procedure.
It's a high stakes, high emotion thing for me. I hope she's going to be okay. I'm concerned, but I'm happy that she's in good hands.
I think we can call it off now. Excellent. You can see the relief in the...
Beautiful, well done.
Let's have a look at the X-ray now.
Munjid, Dan and the team are overjoyed. Sunday's implant has been attached safely to her tibia.
You can see that's sitting very snug. Looks good. Looks very good.
Minutes later, the high-risk, high-tech surgery is over.
Great job.
Thank you so much.
Great job. Excellent. Thank you very much.
We have the implant coming out through the skin at the bottom, really nicely, firmly attached. We're really positive about what we've been able to achieve here.
This can open an era of using this kind of technology for animals that have lost limbs. So it's very exciting.
Matt, g'day.
Hey Dan, how you doing?
Oh, it's good news. All the surgery's gone ahead without any concerns. The implant's exactly where we wanted on the post-operative X-rays. It all looks really, really positive, mate.
Awesome. Good to know.
It'll take several days before Sunday is out of hospital, and then months of rehab to help her get used to her shiny new leg.
Not being able to be with her because of all the COVID stuff, it's probably equal parts difficult for both of us. I'd love to be there to make sure she's okay. We'd find a lot of comfort being there for each other, so it's going to be difficult for both of us, I think.
Good girl, Sunday. Good girl. Been through a lot, haven't you? You've done very well. Good girl.
Just pulled a muscle or something. He's got a broken leg.
On the Gold Coast, Gerardo has just x-rayed George to find out how badly the tiny kitten has injured his leg.
That has got to hurt. Poor little man. They'll need some stabilisation. Patrice, could we set up for bandage, please?
Kittens grow rapidly, so George can't be fitted for a cast.
Now we're going to apply a bandage to George's leg, and that's going to keep that bone in alignment and help it heal faster. And also keep him from putting weight on it, because sometimes they heal very quick and it could re-break. And we definitely don't want that to happen. Kittens are notoriously hard to bandage. We've got to get at least up to that high. Good idea in splitting it down the middle, hey? His leg's so small. If we can keep this bone still for a couple of weeks, there's a fair chance that his fracture might heal pretty quick, like in a fortnight or so. Surely that has to be enough. He is not gonna like this bandage when he wakes up. How about you take him back and recover him, and then I'll come through with a cone, hey?
George will now spend the next few hours being carefully monitored until the anaesthetic wears off.
Here we go. Good boy.
Whoa. Shards of glass.
In Bondi, Kate's shocked at just how deep the cut is on Skippy's paw after the young golden retriever stood on broken glass at the beach.
How are we going to get all this out? So much glass. So they're like tiny, tiny little shards of glass all through this foot. There is a piece of glass. Is that the bottle? It was a bottle apparently.
Yeah, like a beer bottle?
Yeah. Okay, there's a piece there. It's going to be hard to know if we've got all of the glass out. And it's really easy to miss a piece, right? Like there's so many little bits in here, but I can't see any massive bits. Oh, he doesn't like that there. Oh, well, that's deep there. Okay, I feel like now I'm just digging around. I've pulled out as much glass as I can possibly get out with those tweezers. What we're going to need to do from here is give it a really good flush out. This is just some sterile saline to try and see if we can't just flush this wound and any remaining little shards of glass out. So we keep the needle head on when we're flushing so that we can get some pressure and the saline can really get in there and give it a really good flush. Notoriously, these paw pads are terrible at being stitched back together. They've got really bad healing. You can stitch them back together and in 3 days' time, the stitches have pulled apart. I find that the best way to do it is just to bandage them until that they heal and they close themselves. But obviously, if he's walking on it without a bandage, it's not going to get better. It's going to just keep opening up. So let's just put a little wee bandage. It's going to go up above this hock to there. It's going to be a mission to keep this bandage on Skippy. A mission. He has to not have that foot exposed to the elements. He can't be out there running at the dog park with no bandage on. Hi, welcome back. Are you okay? Feeling okay? Don't have any glass in your foot anymore, Skip. The operation's gone really well. 1, 2, and 3. So Skip's 40-kilo backside is going to go into recovery for him to sleep off the rest of his sedation. Hey, Skip. You good? You're good. It's going to be fine. Your leg gets fixed. Now don't chew this bandage off, hey? Good job. Bye, Skip. We'll see you soon.
Okay, here we go. Now I know. Your leg feels better in that bandage.
On the Gold Coast, 7-week-old kitten George has fully recovered from his anaesthetic, and his broken leg is securely bandaged. Now it's time for him to be reunited with his worried owners.
It's time to go home. Hey team, here we have George. Are you gonna come out, say hello? You come out. Hello, George. It does look like a big bandage, but he's able to get around with it, so.
Oh, that's good. Missed that squeaking all afternoon.
I could hear him coming. He's fine to go home, have food and things, and just got to keep him quiet for the next couple of weeks. If up to 3 weeks, 4 weeks, should be all healed. Okay, thanks, Michael.
Thank you.
Thanks, guys. Thank you.
In Bondi, Skippy's owner Dan has arrived after an anxious wait to collect his beloved 2-year-old golden retriever.
Ready? Whoa.
Hey. Hey, good boy. Good boy. He's a good boy. Is it your brave dog? Is that your sore paw? Show me your sore paw. Come on. He seems a lot happier, I tell you. He must have been in a lot of pain, though.
Oh dear, it wasn't very good, was it? It wasn't very good. I'm really happy with how things have gone today. Skippy is a very loved dog. He's going to go home with some antibiotics and some anti-inflammatories, and he's going to stay away from the dog park and away from swimming for at least the next week.
What about saying thanks to Kate?
And he's like, no, I don't want to do that.
No, I want to go home. Thanks. See you.
Bye.
Great news for little Lily. She has survived another cancer scare, with nothing sinister detected in any of the lump samples Scott removed.
Lily is alive, her energy is back, her playfulness is back, her appetite is back. Oh, what a strong dog. I know you're such a strong girl. Oh, yes, you are so strong. Yes, you are.
Owner Karen couldn't be happier, especially as she's now also cancer-free.
She's fine, I'm fine, spring is here. You couldn't ask for more. We're extremely grateful. Come on, let's walk. Come on, let's play.
Nice and slow. Good girl.
It's 3 months since Sunday received her brand new surgically implanted leg.
Look at you go, you're so clever. Sunday's really liking her new prosthetic foot. When she's got it on, she loves it. She walks happily, she runs, she jumps, she plays. She's just very comfortable with it.
Audrey can't wait to see how her star patient is going.
Hi, Matt.
Audrey.
How are you?
Very good, how are you?
Good. Look at your leg.
Yeah.
Look at you. You look so happy. It really couldn't have gone any better.
That was good timing.
Slap me on the face.
Whoa, that's it there. It's like a rock.
On the Gold Coast, Gerardo's patient Teddy is fighting for life after eating something quite bizarre. And Gerardo needs to call in reinforcements for emergency surgery.
Hey, Trooper.
Hey, what's up?
Hey, I need you to come here as quick as you can.
What's going on?
We have a dog here that ate Gorilla Glue.
What is Gorilla Glue?
It is a super strong adhesive.
And it's formed a big ball in its stomach, and it's huge.
I will be there shortly. See you soon.
Check out the X-ray. This is scarily impressive.
Wow, look at that.
That's what we're looking at here.
The X-ray shows a dilated stomach that's full of the glue. It's quite shocking.
It looks like it's formed a ball in there. So you'd really hope that if we could go in there, it may just come out as a ball, but my worry would be that if it's actually stuck to the stomach lining, that we may have to reset part of the stomach itself.
I've never seen this before, but I'm not surprised. I've seen dogs eat a lot of crazy things.
That's a 10 by 12 centimetre ball. That's not going to be easy to cut out of the stomach.
There's a number of things I'm concerned about today. There's the obvious gut obstruction, but there's also a chance that this glue may have perforated the stomach.
If Teddy's stomach is perforated, then he would be in a world of trouble. We'd be dealing with a very complex surgery and also an overwhelming infection.
Here he is.
Oh wow, he's already ready to go.
Yeah, the team have got him ready to go. It's clipping his belly at the moment. Hey.
The patient today is Teddy. Teddy is a beautiful groodle.
He is cute like a teddy bear, isn't he?
What were you thinking? What were you thinking, you silly boy?
Probably thought it was like a tube of like caramel or something like that.
I can imagine it tasting good. Teddy's already on the table, sedated and being prepped for anaesthetic. Let's get into surgery.
Yeah. Okay, team.
In these moments, it's also really important to reassure Teddy. He doesn't know what's going on and he must be scared. What a day, hey? What a day.
Here we are.
Mobile vets Audrey and Alison have been called out to a local kitten shelter to check on a worrying new little arrival.
Hi, Amy.
Amy runs the Kitten Sanctuary, dedicated to saving fragile tiny lives that are otherwise unwanted and abandoned.
Do you mind?
Been operating for about over 3 years officially now, specialising in taking in orphan neonatal kittens, which are at the highest rate of euthanasia across pounds and shelters in Australia. So we are one of the very few rescues that do take in kittens this young and hand raise them.
These playful youngsters look right at home, but Amy has grave concerns about a new kitten called Misty.
Oh. Somebody found her on the side of the road and we took her in.
The 5-week-old kitten developed a badly infected toe after fellow orphan Stormy kept trying to suck on it.
Looks very festy, doesn't it? I think we better have a look at that.
Misty is so tiny, she's being kept in a special warm incubator.
All right, well, let's take her out, have a look at that foot.
Amy's desperately hoping the twins will be able to save the tiny kitten's toe.
I might check the rest of her over and then we'll end up at that toe. Just make sure you're growing okay. Now let's have a look at that toe, right? So she's been on broad spectrum antibiotics for about a week.
Since then, her appetite's gone up, weight's gone up, she's been more playful, but the infection just isn't improving on the toe.
And if anything, that's actually looking more swollen and more infected. So I'm worried that that infection's getting worse or possibly spreading.
Just notice she's got a little swelling on this back left leg here.
Yes, she does.
Oh no.
Oh, that doesn't
baby. She has been licking and chewing at all her joints after licking, obviously, this infected toe, so she could possibly have passed the infection.
The danger of an infection in a young kitten, especially one that you can't get on top of, is that that infection will spread. It will either spread along the foot or it will go into the bloodstream, and once it's in the bloodstream, it pretty much can be fatal.
Oh, it's so swollen.
Oh.
Here we go. Go in here. There we go. Ready? Good boy.
In the UK, Scott's arriving at his Isleworth practice with a special little boy.
Hi, ladies. Let me introduce you to Biggie, obviously, isn't it?
Biggie is a 1-year-old Chihuahua who's a regular visitor to Scott's house.
He's my builder's dog. See, it's quite funny as well because he's covered in tattoos. He likes motorbikes. You know, he's that kind of guy. And then he's got a little, tiny little dog. But unfortunately, he's got a bit of an embarrassing problem. He's only got one testicle. So often we see in the veterinary practice these little dogs that have been significantly inbred, or you've had 2 runts of the litter come together to make even more puppies, and they weren't healthy in the first place. And in the case of Biggie, we just need to go and find a testicle which naturally should be outside his body. So I think in this case we're going to have to do a fishing expedition. So sort of like be putting a hole in the abdomen and then trying to hook out the testicle.
Testicles left inside the body where the temperature is higher can lead to mutation and cancer. For Biggie to be cancer-free, both testicles will have to be removed. Maybe not so exciting for Biggie, but a new learning opportunity for vet student Sophie.
I've not actually seen one before.
You've not seen one before? Oh, okay. You know ice hole fishing?
Mm-hmm.
Yeah, it's like that. It is. So basically, yeah, just make a little hole and then you just go fishing. Instead of pulling out a salmon, you pull out a testicle.
Nice.
All right, should we put an IV in you? I don't think you need to be a vet to realise that little dogs are more fragile. And all small patients, we take a view, they're almost like babies. Okay, sleepy time now, little man.
Suddenly, seconds after being given anaesthetic, Biggie's in trouble.
Just give him a little puff of air, would you?
The little dog's heart rate is dangerously slow.
Come on, mate.
Gotta look at that paw now, okay? I'm worried that great. So it looks like the infection's kind of dissolved away the bone, which isn't great. I'm very, very worried if we leave it there, she could potentially lose her whole foot or her whole leg. So we need to jump in quickly and remove the infected bones. Getting a heart rate?
But suddenly the tiny kitten is in grave danger.
1, 2, 3, 4, 5. 1, 2, 3.
She's not really stable. Her breathing is all over the place. We're having to give her artificial respiration because her oxygen is not quite 100%.
How is he light and then deep? 1, 2, 3. It's always really difficult in little cats because everything's super tiny. So trying to get a tube in is difficult. Trying to get her oxygen levels is difficult. Oh, they're so tiny.
Hello, how are you? I'm Dr. Kate.
At the Bondi Vet Hospital, worried owner Lana has brought in 15-year-old Max because he's stopped eating.
You're an old boy, aren't you, buddy? So he hasn't eaten for 2 days.
Yeah, 2.5.
It's okay, Max. You right, buddy? Not very well. Come on, Maxie. Let's go in. Let's take Maxie in.
I got him when he was 6 weeks old. He's part of my family.
He's lost a lot of weight since we saw him last. Do you think he's lost a lot of weight?
I think it's age. He always ate normal. Only the last couple of days he had this problem.
When I saw Max on the schedule today and I saw that he hadn't been eating for quite a while, that makes my heart sink. especially in a 16, 17-year-old dog. Not eating for a couple of days, lost 7 kilos in a year. It's a concern. Maxie, it's blind.
I think he's blind.
Yeah, no, he's blind.
Max, I think it's a continuation of what's happened 2 years ago. His body not so good.
See his breathing like this? Right, see how he's like struggling to get air in? You can see his abdomen there that's moving. You right? So you hear that cough? So he's got fluid in his chest. It's like kind of having like a wet sponge, and they can't actually fill with oxygen. So what's happening, he would be feeling right now like he would have asthma.
Main thing, do a blood test, full blood test. If something wrong, blood test will show you something wrong.
I think what Lana would like me to say is that we can do all these tests and we can do all of these treatments and that Max is gonna get better. And sometimes that is the case, sometimes that is the case. So there is some point to do a blood test. We can get some clues and we can get some leads about where we actually go to from here. But Max is a very, very elderly dog. 16 to 17 years old is a very old dog. Can I get Max better? I don't know. He's a good boy, isn't he?
His family must be distraught, I imagine.
Oh, yeah.
On the Gold Coast, Teddy the Groodle is in grave danger after eating an entire tube of toxic glue.
Blade, anaesthetic. Okay.
Ready to go to sleep, little man? Good boy.
Alex and Gerardo are extremely worried the dangerous glue is rapidly expanding in Teddy's stomach.
Let's go.
Hey, mate.
Oxygen is on 2.
All right, Teddy. Little sleep, okay? Good boy.
Teddy needs urgent emergency surgery to see if the large mass of glue can be safely removed.
Good boy.
Hopefully when you wake up, you'll have fixed the problem. Good boy.
Oh, and okay.
Oh,
it's all right. It's all right.
There we go. There we go. Good boy. Now that Teddy's asleep, the time's really ticking. We need to get him into theatre and get this out of the stomach as quickly as we can and wake him up. He's a sick dog, there's a higher anaesthetic risk, and we don't know what damage this glue has already done to his stomach.
Okay. Rosie, you want to take those 2? And then Alex, thank you.
No worries.
Okay. Whoa, actually feel there. Just push here.
Ooh, that's the stomach.
That's it, there. It's like a rock.
Oh, just be careful you don't cut into that when you go through.
Right under the skin.
My hope now is that we can enter the abdomen fairly easily. It could be tricky because Teddy has had abdominal surgery before.
I'm going to go slow because there could be...
The stomach's just underneath.
Teddy's previous surgery could have left him with internal scars that could complicate the operation.
Okay, cool.
What are we going to find in there?
Well, the good thing is that the stomach's not stuck to the abdominal wall. That's
one good thing.
The one good thing. Okay. Whoa. I just touched the stomach then and it's rock hard.
God, how much must that have hurt?
It expands, apparently.
As emergency clinicians, everybody knows their role in these high-pressure situations.
His heart rate's pretty steady. It's actually good.
You really have to bring your A game.
Okay.
What do we got?
Feel that.
Oh my God.
That is like a rock.
I can see it under the surface of the stomach.
You can see it through there? Wow.
Literally through there.
Yeah, we need to open up the abdomen, spleen. Let's have a look what we got here. He's like rock hard.
Have you ever seen anything like this?
No, this would have to be the biggest foreign body I've ever removed.
So getting exposure to the stomach is quite difficult because it sits right underneath Teddy's ribs. So what we're going to try to do now is place some what we call stay sutures, which we'll then use to elevate the stomach. So we want to almost get the stomach out of the abdomen
and then we're going to cut into it, and I'm hoping we can remove it. Yeah, there's a lot of weight there, isn't there?
It is a heavy foreign body.
The last thing we want to do is actually tear through the tissue, trying to get enough elevation.
Okay, let's see if we can pull it out. We got omentum adhered to the stomach from the previous surgery.
The stakes are really high here. We're dealing with a member of someone's family, and we want to be able to call them at the end of this surgery and tell them that it's been a success.
Oh gosh, imagine if it's actually stuck to the wall.
One of the things we're worried about here is when we cut into the stomach, because we can't lift the stomach up very much, we're actually going to get spillage of gastric contents into his abdomen. He's already on antibiotics, but if that happens, we've then got infection that's spread around the rest of his abdomen. We really don't want that to happen, and we really didn't need more complications than we already have.
You right? So you hear that cough? So he's got fluid in his chest.
In Bondi, Kate is starting to have grave concerns about elderly dog Max. She's doing urgent blood tests to find out why he's not eating and is struggling to breathe.
There we go, buddy. So what I'm going to do is run some in-house bloods. They're going to be back within the next sort of hour or so.
Just help him, please. Moose.
Devoted owner Lana can't imagine life without her special boy.
I want him to live much longer, because he's a pleasure.
Next, Kate is doing an X-ray to see what's going on with Max's breathing.
With Max's lungs is that there's not much black in here. So all we can see is that there's a whole bunch of fluid that exists in this chest cavity. This all here is lung field, and this is supposed to be black, and it's not. I have a sneaking suspicion that this is actually probably coming from his right side of his heart. In other words, his right side of his heart's possibly collapsed and failing.
If I can help, I help, because I'm against just do a job and next dog. Sorry, that's part of my family.
Lana is now desperately hoping Max's blood results are good.
So what we can see here is we're starting to get into multi-organ dysfunction. We've got high kidney enzymes. In fact, one of his kidney enzymes is so high that it's actually unable to read on this machine. I'm really devastated about these blood results. I can't give Max new kidneys. I can't give Max a new liver. A lot of these problems, I can't make his bone marrow produce more red blood cells. So this may be the end for Max.
One, two, three, 4, 5.
In Sydney, Misty's toe surgery is barely underway and the little kitten is in serious trouble.
Good girl. I see 100. That is very, very good.
Finally, the twins get Misty's breathing under control and they can now go ahead with the surgery on her infected toe.
What I'm doing is trying to leave as much of healthy skin as I can attached to the foot so that when I remove the infected bones, there's enough skin to close. What I might do is just leave wide
At the bottom. It's just coming away.
Dead. The tiniest toes you've ever seen. We're done.
With the toe surgery over, the girls have given this tiny battler a fighting chance.
We're going to do about 5 of those. All right, we can turn her anaesthetic depth down. So all taken off, sutures are all in. Hello, good morning. I'm going to put you in here where it's nice and warm. Hi, Amy. All good. She's in recovery now. Come on through. Missy's recovering really well. We've just got her back in her incubator where it's nice and warm. Awesome. Was a very big surgery because we removed that necrotic bone or that bone that was infected. That came away really nicely for us and we were able to close up.
I'm so relieved everything went well with the surgery. I knew Missy was in the best hands with Audrey and Alison.
You can show Mama your boxer gloves. Hey, baby.
Okay.
Yeah, she's recovering so well. So she's going to be a little bit groggy for the rest of today, but as soon as she's up and swallowing properly, I think give her a bottle.
Okay.
And I want you to continue on with those antibiotics. Oh, you're looking for your bottle. We better get you home so you can have some milk, all right?
So groggy.
This is it. Okay, I'm going to try and wrap that around.
On the Gold Coast, Alex and Gerardo are desperately trying to save Teddy after the greedy Groodle ate an entire tube of glue.
Spleen out of the way.
It's now expanded and hardened in his stomach. Scarring from previous surgery is making this operation extremely difficult.
Okay, stab incision into stomach.
Depends a bit about what else he's had to eat, you know.
Okay, I have to use my hands. Normally we don't put our hands in stomachs.
Compared to humans, dogs eat all sorts of random things, and we know that Teddy has eaten other things, so we just don't know what we're going to find in his stomach. Yeah,
Okay.
I think we just had no choice this time.
It feels like a rock that's covered in goop and grit.
Gerardo and I have made the incision into the stomach and you start to be able to smell the contents.
Ugh.
Oh yeah, it's coming now. Holy.
Oh my goodness.
Looks like a cauliflower. Make sure we hold up the...
Yep, I got it. I got it.
You got it?
Yep.
Look at that.
Wow. It's got bits of corn on it.
What is that? It's a potato chip.
It looks disgusting. It's this solid rock, but it's covered with bits of corn and chips and other things that Teddy's eaten. And the smell was overpowering. I could almost taste it.
Wow, he must have eaten the whole tube of glue. That's nuts. Inside lining of the stomach looks pretty healthy.
No, actually, we're pretty lucky. I think all the mucus kind of kept it off. Thank you. I could not have done this without you.
Actually, you probably could have done, but that's all right. I was glad I was assisting.
You can feel the tension ease in the room. It's been a textbook surgery so far.
You all right if I tap out then?
Yeah, you go.
I'll go get Teddy's bed ready for recovery.
Yeah, we shouldn't be too long.
Yep, okay.
Almost halfway done.
Awesome job, hey?
No, thank you. I'd shake your hands, but your hands are dead.
All right. That was fascinating to see. He is one really lucky dog. He's going to be quite painful when he wakes up, but all in all, I think we can call that surgery a huge success.
Let's go.
In Sydney, Audrey and vet nurse Brianna have had a call out to check up on one of their regular patients, Harley. The Cavalier has developed worrying stomach issues.
All right, we'll have to see Harley again. Yes. He's got itchy skin, diarrhea, itchy bottom, bad eyes. So Again? gotta check him out. Yeah. Here we are.
Hey, good boy.
Harley's owner Monique is understandably worried about her beloved 5-year-old.
We love Harley. He's such a big part of our family. He's always happy. That tail just never stops wagging. He's just adorable. He's the happiest dog I've ever seen. It's very hard when we watch Harley with a sore stomach. He knows he's not well and he puts himself to bed, and that's just not Harley.
Hello. Hi, Monique. Hi, Harley.
Hi, Audrey. Hi, Brie.
What's been going on?
Look, he's doing well, but he's having a few problems with his stomach. Quite a bit of diarrhea and scooting on his bum, which isn't very nice.
Oh dear. So he's had these gut issues on and off, and I know that he gets the diarrhea and the gurgly tummy. Is
Yes.
he eating at all?
Yeah, he's eating quite well, but it's not staying in.
Oh, buddy.
It's coming out the other end. And I have also noticed his skin's a bit dry and
It is,
flaky.
isn't it?
Yeah.
All right, well, we better get you in the van, check you out, buddy, hey? You want to come for a little adventure in the van? Okay, we'll see you later, Mum. Bye. We really don't want Harley having gut issues long term. having diarrhea, having vomiting. That's going to cause gland issues, but also it's going to cause malabsorption. He'll fail to thrive, he may not gain weight, he could get super skinny, so we really need to address it. You ready? All right. I know you're a bit nervous. It's okay. Let's have a listen to you, your tummy, your gurgles. Oh, that's only a bit squelchy in there. Lots of movement. Oh, buddy, what is happening? Oh, not happy in there at all.
Your anesthetic now, boy. Okay, sleepy time now, little man.
Come on, baby.
At his Isleworth clinic, Scott is alarmed that Chihuahua Biggie has suddenly stopped breathing.
Have a breath.
Scott needs to perform a testicle removal, but the little dog isn't responding well to the anaesthetic.
And his heart's slowing. Come on, mate. This is incredibly frightening. I'm listening so intently, but I can hear that the heartbeat is just getting fainter and fainter. Jam, can you just get a little bit of adrenaline? Just keep breathing for him. Quick, Jam. That's fine. Come on, mate. Just keep breathing, 1 every 2. Keep breathing for him. Those waves are looking a bit more regular now. Bloody hell, this job, honestly, makes you go grey.
I think I just aged 10 years.
Yeah. And what's even worse is the stress of when it's someone's dog that you know. Yeah. It somehow makes it worse. He was having a little look at the Rainbow Bridge then. I think he saw a squirrel on the other side. So that's the danger of anaesthetics. You know, we deal every day with life and death, and our job is beyond serious, you know. And you can laugh about, you know, a little dog called Biggie with 1 testicle, but, you know, it's a much loved member of the family, and, you know, when things like this happen, it just reminds you just how important life is, and how important our job is. Just keep breathing, just keep breathing. That's for you guys and the dog.
With Biggie finally breathing normally, Scott can start trying to locate the missing testicle.
So this is going to be speedy ice fishing. This is not ice fishing for pleasure. This is for a specific purpose of catching the infamous testicle fish. It's very likely that it'll be a lot smaller than the other one. Lots of reasons why it's difficult to find. But I've just found it. So look at that. There you go. So you can see immediately that's 1 testicle and that's another. So
Dogs are in danger of cancer if testicles remain inside the body. So Biggie will now have to have both testicles removed.
There you have it. 1 naughty testicle. Okay. So there's Biggie, there's Smalley. Biggie can now look forward to a long and healthy future. Now that we know that that testicle that was hiding away in his abdomen is out, there's no chance that he can develop cancer as a result. And hopefully, I'll never, ever, ever have to anaesthetize Biggie ever again. I'm so relieved to have the ability to wake this dog up. You know, you just be able to hear him breathing and hear the beeping and know that he's okay is a massive relief. You all right, buddy? Hi. Hi. Wow, what a relief. I just think when Biggie's heart nearly stopped in there, honestly, mine did too. To think that that little life that was in my hands was slipping away. Like, honestly, Biggie, what are you trying to do to me?
Oh, come on. That's it.
Biggie will have a sleep before being reunited with owner Stu.
Oh, you look so cute.
I can't give Max new kidneys. I can't give Max a new liver.
In Bondi, Kate is devastated that Max's blood results are so grim.
A lot of these problems, I can't make his bone marrow produce more red blood cells.
Lana has had her beloved Max since he was a pup, and every moment separated from him is heartbreaking.
You right, Maxie? He's just having a little sleep.
Kate now has to gently explain to Lana how much Max's health is deteriorating.
Max is a very, very sick dog. He's 100% suffering. And I'm not entirely sure right now that Lana knows how sick Max is. I'm really sorry. He's not going to come back from this. Honestly, I don't even know that he's going to make it the night. Like, he's just deteriorated today to a point like all he wants to do is sleep. One of the very difficult things about being a vet is to bring up the idea of potentially putting the dog to sleep. It's a very difficult conversation to have. No. And honestly, I feel as though that the duty that I have is to relieve suffering. And I try and see this in the most positive light as I possibly can see this, is to relieve suffering. And I hope I can do that job well. Poor Max.
Later that day, Max's brave battle ended peacefully with Lana by his side.
Listen to your tummy. Oh, that's sounding a bit squelchy in there. Lots of movement. Oh, not happy in there at all.
In Sydney, Audrey and vet nurse Brianna are trying to find out why Harley has suddenly developed stomach issues and diarrhoea.
All right, let me just have a look at your gum colour. Okay, the good thing with him is he's still eating and drinking, so we'll caught it early, but it's just not sounding good in there. You have a feel.
It's becoming a bit of a problem.
It's all right, Harley. It's okay. All right, so we're not happy in there. We know you're having the runs. Next step, I think we have to check your bottom out. It's not your favourite part, but from history, every time he gets the diarrhoea, his anal glands block up.
I know, it's okay. It's okay.
Sorry, baby. Oh, they are full. So on top of having a really bad tummy, he also has anal gland issues. And these are basically two little glands that sit on the outside, and they become blocked if they're having diarrhoea or soft stools. I know, almost done, almost done. You know this one takes a long time. When the anal glands become blocked, it becomes very uncomfortable. They're quite sore, they might scoot. It's really, really itchy. Okay, well, the skin, the diarrhoea, the bottom, I think we need to look at a long-term solution with diet. All right, buddy?
See if we can make your tummy all better.
All right, let's get you back to mum. I have a solution for Harley today. It's diet-based. He's got a bag of problems from allergy to dietary intolerance.
I know, you're very eager to go back to mum.
So I really want to address the food he's taking in. All right, Mum, he was a very good boy.
Oh, that's good. How were his glands?
So his glands, as expected, were a little bit full, and that's because he's been having softer stools, so they block up really easily. I am quite concerned with his gut. It does sound very squelchy. He's a little bit sore when we go to feel him, but lucky for us, it's pretty early. He's still eating, he's still drinking, but long term, I think we need to look at his diet and try and prevent this from happening. Yeah. So brought along one of my favorite products. We'll try him out on the diet for a couple of weeks, and then I'll touch base with you and see how he's going. But hopefully he's going to resolve his gastrointestinal issues. I have a sneaky suspicion he's going to like it because he's checking it out already. Oh, what's that?
Oh,
You want to try?
he wants
Smells
that.
good. It's chicken. Oh, I think he likes it.
He likes it.
Good? You like that? I can tell.
Because we're putting Harley on a single protein trial, this is going to be the only food he's going to eat. It's complete and it's balanced. Well, that's really good, Monique. I think I'm really happy that he likes it. I'm going to leave you two with that for the next couple of weeks, and then we'll check in again on his tummy and his skin and see how he goes.
Sounds good.
All right. Sound like a plan? Sound like a good plan. All right, we'll see you soon.
Bye.
Be good for Mama.
I'm very excited to try the new food on Harley and to finally resolve his stomach issues and to get him back to being the happy dog he should be. Will we give it a try? I think so. Yes? Okay. Good boy.
Oh, Teddy.
Back on the Gold Coast,
Teddy, good man.
Teddy is finally awake after life-saving surgery to remove a massive lump of hardened glue from his stomach.
You standing already? Such a brave man. Teddy has recovered from surgery. Oh, stay still. His belly is a bit sore, but that's to be expected. The team are going to keep a close eye on him and make sure that he is comfortable. Overall, this is a great outcome.
You're wobbly, hey? You still got a bit more time recovering, hey? Hey, you're a very brave soul. So you got it all out. The team's gonna take care of you, so it could be a good way.
See a little Harley boy.
In Sydney, it's been 2 weeks since Audrey and Brianna last visited Harley, who had some worrying stomach problems.
Okay. Heard it's his birthday today.
It's his birthday today.
All right.
They're hoping a change of diet has helped improve the young cavalier's condition.
What do we do? Hello, Harley. Hi, Monique. Hi, baby. Hi. How's he been?
He's going really well. His stomach issues are so much better. So the diarrhea has absolutely disappeared. He doesn't have a gurgly tummy anymore. And his skin's even looking better too. He's back to his original self.
Amazing. That's what we want. I mean, it's only 2 weeks into the diet and he's still got another 6 to 8 weeks, but I think he loves the food. It's going great. It's all uphill from now. And I did hear it was his birthday.
Yes, he is 6 today.
Harley, you're 6 today, and because you can't have any other food, so we couldn't bring you a birthday cake, we bought you a toy cake. What's that?
Is it your birthday?
Oh, he likes that.
Happy birthday from Auntie Brie and Auntie Audrey.
Birthday.
You're a good boy. I'm really happy with Harley today. He's happy, he's healthy, he's going to the toilet normally, and his skin is also looking good. So I'll check in again in about 6 to 7 weeks, and he's on the right track. Bye, Harley!
It's wonderful. There's nothing worse than seeing your dog upset and sad and in pain. And the food has worked so well. He's back to his happy self and we couldn't be happier.
That's my boy. Yes, so beautiful.
Da, 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 da. There he is. Come on, let's go see Daddy. Come on. Oh, there, little tyke.
In Isleworth, Builder Stu has arrived to pick up Biggie the Chihuahua and to hear about the little dog's traumatic testicle removal surgery.
So I've come to pick up my little boy after having been castrated, and yeah, hopefully it's all gone all right.
Hello, mate.
Oh, hi. Oh, hello, little man. Oh, look at your silly little cone.
There he is.
Is he all right?
Yes, he is now. The surgery went absolutely fine, but yeah, he did give us a massive scare because he decided,
Oh, really?
Yeah. When we first anaesthetised him, he stopped breathing, which a lot of the time...
Jesus.
Yeah. A lot of the time they do stop breathing initially and then they come right. But he just stayed not breathing. And then his heart started to slow. So we had to give him adrenaline and fluids and
cry.
yeah.
Jesus.
My nurse, who is a trainee vet, I think she's thinking twice about a career. Maybe she'll come into building trade.
Yeah, to be fair, I could do with a hand on a sleeper wall.
Yeah, sure. Okay, yeah. Genuinely, it's great to be able to have a bit of a laugh with Stu and to put a smile back on his face, because I can see just how shocked he was, the fact that Biggie was so close to death. But look, these two are such great mates, and it's just so great to be able to hand this dog back in one piece. Well, without his crown jewels, of course.
Thanks a lot, and I'll catch you soon.
Bye, bud. Bye, lads. Bye.
He's dirty.
2 weeks later, Biggie the Chihuahua is back on the worksite with owner Stu after Scott successfully removed both his testicles.
You're gonna fight to survive, aren't you?
As for little kitten Misty, she's making a good recovery after her toe surgery.
So all the stitches are intact. That's healing really nicely. There's no swelling or discharge. The other toes look great.
And hopefully she'll soon be well enough to go to a loving new home.
So I'm super happy with how it's healing. I think we got it just in the nick of time. No, I love you too. No.
At Kate's Bondi Vet Hospital, an anxious Carolyn has arrived with her best mate Archie.
It's okay.
Archie is usually lively and outgoing, but recently he's been seriously unwell.
He's been throwing up for the last few days, so I thought I'd take him down to get him looked at because he's just not himself at all. I mean, he's a dog, but he's like my little child, right?
Hello.
Hi, how are you?
Haven't seen you in a while.
Yeah.
Hey Archie, you've been very sick. Would you like to come in so we can talk about you? Like a tummy scratch. You're a good dog. Good boy. Come on, buddy. Well done. All right, Arch. So what's been going on?
Last night he was up like probably about 4 times, like vomiting. And then today, when I was walking him, he was like vomiting. And then I went to acupuncture for an hour and I came home, he vomited all over the couch.
Archie's come in because he's vomiting. Not once, not twice, but a number of times. Vomiting this long a period, multiple times, it's not great. This is unlike him.
Very much so,
Yeah.
like he's not like that at all. Like he's like the life of the party.
Chances are, if we're lucky, that what we're dealing with is a gastro.
Yeah.
Right? So that's our best case scenario.
Yeah.
But saying that is obviously our worst case scenario is that he's eaten something and it's stuck.
Yeah.
Are you ready, buddy? Okay, 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 okay. Okay.
There you go, matey. Oopsie doops. You got your little feet on? There you go, mate.
So he is quite dehydrated.
Yeah.
You can see in his gums, like these gums are what we call quite tacky, you know, like they're just not that wet.
Yeah.
His heart rate's a bit high. We're suggesting he's got pain somewhere.
Yeah.
Oh, is that sore, is it? Do you feel like you're going to vomit? Are you okay? Oh, Archie. He's quite sore in this tummy.
Yeah.
And the more I press on it, the more nauseous he gets. There's a few things that are really concerning here. He's got abdominal pain, he's really lethargic, he's vomiting multiple times, and he's also got a fast heart rate, which means that he's painful somewhere.
Kate will need to carry out urgent tests to find out exactly what's wrong with Archie.
Good boy.
Hey, I'm ready.
At the Australian Reptile Park, Tim and Jake are on their way to pick up an unusually large lunch order.
Whoa! Watch out there.
For a cantankerous crocodile called Elvis.
Dan's the worst driver on earth. You got it? Yep. Today is a big day at the reptile park. Exciting, rewarding, and very dangerous.
Nice. Good bit.
Very nice. We've got to feed Elvis half a cow.
Rope's on? Yeah, rope's ready to go. If you trust my knot.
What'd you do if you don't know knots? Tie lots?
Tie lots. Yeah, that's a good knot. That's my best knot.
Good morning, big fella. There's a big chunk of beef making its way through the park. And whose ears prick up? The carnivores. They can smell it. Hey, Dina. Hey, Lucky. Hey, Freddie. Oh, the devils are straight onto it. You can smell it. The park's coming to life. There he is. From the second we arrived at Elvis's yard, his eyes popped out of his head. That tells me one thing. Elvis has smelt the beef and he knows what's coming. Shall we have a little briefing?
Yep,
Yeah?
sounds good.
But we've also got a couple of rookies along, young Jake and young Sam. It's the first time they've ever done this. So that brings in a sense of nervousness, excitement, but it's key for them to learn and develop in these areas. It's arguably the most dangerous job you can do at the park. Safety's paramount. You two lads haven't done this before, so listen to the people that have, and people that have, look after our mates. And mate, no trips, no slips, no falls.
It's going to be insanely challenging. Like, the power which they've got is insane. So it's going to take more than just me, a couple of the boys, to be able to keep that food away from him. Let's just hope I don't need a spare pair of undies after today.
We all know this is in the interest of enriching Elvis's day. You know, that's why we're doing it. Anything you want to add, mate?
Yeah, real simple. I'll be on croc. If I say get out, get out.
No
Straight
practice runs.
No practice runs.
No practice
I don't
runs.
muck around. If I say get out, like I've nearly seen this go wrong before. It cost me 20 stitches in my leg. You get out quick.
That's the result of the fence. Bit of fun and games. We enjoy it, but it's very serious. And when it goes wrong, I mean, that was wrong and he busted it on the fence. Thankfully, it wasn't Elvis. And we learnt from that, so no mistakes today. Here he comes. He knows. We're talking about a croc here that's eating lawnmowers. If we try and get the meat in now, he will charge us.
I reckon he's looking at us. Oh,
He's
there he is.
keeping an eye on us, is he?
That's a bit scary, actually.
Yeah, he's ready.
Yeah.
We're now going to slip Dan and Sam in, and they're going to lure Elvis around the other side of the yard. You're acutely aware of the fact that, you know, you slip up, the end result can be death. Righto, boys, take it away.
All right, Sam, you with me? Let's go. Just watch Elvis on that bit, Sam. I'm going to go to the back wall. He's on you. He can smell fresh blood.
Okay, who do we have first today?
At the Lost Dogs home in North Melbourne, Danny's shift is about to start.
Oh, little Mo. Okay, great. Hi, Mo. Good morning.
Attendant Ashley is getting the first patient, a 10-month-old stray cat called Mo.
Hello. You want to have some playtime later? Have some cuddles? You're in a good mood.
Hey, Ashley, how you going?
Hey, how are you? This is Mo.
Hi, Mo. Hi, you darling. Hi.
He's
You're
such a sweet little boy.
Isn't he smoochy? I haven't been working at the Lost Dogs home very long, but it feels like I've found my home.
Very happy, very friendly. Always happy to see people.
Oh, sweetheart. You just want to go and explore, don't you, hey?
It's feared the young stray may be suffering from some sort of injury.
How did little Mo come to us, do you know?
I don't know his full story. I know that he was a stray that was brought in by one of our local councils.
Okay, sure.
So he's most likely a street cat, making it on his own.
Oh, well, you're very sweet. So he's obviously had some sort of trauma because I've heard that he's got an avulsed lip. So I'll just see if you'll let me have a little look at that. So that right side, oh yes, I can see. So I'm just having a look at Mo's mouth and I can see that there's a section of his lip that has actually been ripped off his bone. Oh, darling. But he's still this happy little sweet smoochy cat. So that would have hurt so much. His poor lip has actually been ripped off his jaw, my gosh. The area of the mouth that's affected at the moment is looking like it's healing quite nicely, which is good, but I am concerned as to whether there's been any damage to the canine. So we will need to get some dental x-rays today to have a look at the tooth and also the bones in the jaw. I wonder what's happened to you, my darling.
I've noticed as well, I don't know if there's something happened to his back legs, his hind legs.
Okay.
He walks a little bit funny sometimes.
Oh, okay. Right, we'll have a
More
look.
particularly on his right side.
Okay. I might get you just to hold the front here
Yes, of
so he
course.
doesn't walk away.
It's okay, Mo.
Oh. So there's definitely restricted movement in that right hip there. So I think we'll get some x-rays today and see what's going on there.
Okay, wonderful.
Probably all to do with whatever trauma you've had, my sweetheart, you poor thing. He's all set. Sort out that broken tooth and that avul's lip. We'll get some x-rays of the hip and see what's going on there, and hopefully we can get that resolved as well.
Perfect.
Hey, beautiful. Oh, you're such a darling. I know. We're gonna get you all sorted though, mate, hey?
His heart rate's a bit high. We're suggesting he's got pain somewhere.
Yeah.
Oh, is that sore, is it? Do you feel like you're going to vomit?
In Bondi, Kate is trying to work out why Cocker Spaniel Archie has been repeatedly vomiting.
So there's something going on in this top part of his tummy.
Yeah.
So the other thing that we should potentially rule out is that he doesn't have something like a pancreatitis, for example.
Yeah.
Right, so pancreatitis is where the pancreas is inflamed. Often it's bacterial in origin.
Yeah.
And it can make them feel very, very sick. He's very good at telling you there's something wrong with him, isn't there? He's very communicative. It's okay, don't worry. Don't worry, I'm going to look after you.
Carolyn is devastated at the possibility of something seriously wrong with her precious boy.
Archie has been with me for such a long time. He's been through so much with me as well, and every single time I go through a health scare myself, he's just always there to make everything better. I can see that he's a bit scared and he's nervous and he's in pain. But leaving him at the vet was pretty painful to sort of walk away from him.
Good boy.
Kate's hoping a blood test will provide some clues about why Archie is so unwell.
What have you got for me?
So coag, AP, TT and PT are both normal.
Okay, but what's abnormal is that we've got some white blood cells here that are high. So either we've got a foreign body stuck or we've got pancreatitis. Okay, buddy.
Legs towards us.
Legs towards the wall.
The wall?
Yeah. 1, 2, 3.
Good boy.
Next, Kate is going to x-ray Archie's intestine to look for any potential fatal blockages.
X-ray. As soon as I take these x-rays, I look at the screen and my heart just drops. This pattern of gas, classic for something stuck. So he's definitely got pancreatitis, right?
Something might be setting it off.
Ooh. See that?
Kate asks fellow vet Edwina to confirm her suspicions.
Do you feel that?
Just there.
If something is stuck in that intestine, it's death. You never ever let a sun go down on an obstructive foreign body.
Kate must now make a difficult call to Archie's owner, Carolyn.
Hey Carolyn, how are you? It's Dr. Kate. I'm going to have a chat to her about what she wants to do. Whether she wants to hold on this, whether she wants to leave it 24 hours, see if we get anywhere with just some intravenous fluids, or whether we actually go to surgery now. So I know it's big decisions. Do we risk opening him up, not finding anything, or do we actually risk that potentially by tomorrow afternoon that he could be dead? It's at a point where we think, you know what, if he was mine, I'd probably be bold enough to actually just go in.
Carolyn is understandably worried, but agrees to immediate surgery for Archie.
Okay, no worries. I'll speak to you soon. Oh boy, mate.
That would have hurt so much. His poor lip has actually been ripped off. And there's definitely restricted movement in that right hip there.
At the Lost Dogs home in Melbourne,
We'll see what's going on with you, hey?
Danny is about to x-ray 10-month-old stray cat Mo, starting with his worrying jaw.
Okay, x-ray.
Next, Danny is concerned about Mo's hips and the possibility he may have suffered a serious injury.
X-ray.
Danny will be working with guidance from the Lost Dogs home senior vet, Sue.
So that's the tooth in question. It's looking pretty good. I can't see any
There's a
damage.
little bit of damage there, but
Yeah, where
I
that
think that
avulsion
tooth is
is.
fine.
One less problem. The canine tooth looks great. We don't need to take that out, which is wonderful. But that right leg, oh my God, the poor cat.
So that cat will be in a lot of pain.
Oh
There's
my God, the
multiple
poor
breaks
thing.
there, and there's actually a few fragments around there. That's really nasty.
Just all that, the fragments just rubbing up against each other would just be so painful.
And it's going to need surgery. Mo, unfortunately, has probably been hit by a car. His back leg is not actually attached to his pelvis at the moment, and he's got multiple fragments that we need to deal with. This is a really bad break, and it takes a huge force to do this.
So we're just getting Mo all prepped for surgery so that we can get all those fragments out of his poor little hip. But there's still the risk that we could cause nerve damage in the process. If that happens, then it may mean Mo has to lose his leg.
He's on you. He can smell fresh blood.
At the Australian Reptile Park, it's feeding time for the 500-kilo, 60-year-old crocodile Elvis.
Everyone good?
It's also a baptism of fire for Tim's two rookies, Jake and Sam.
I'll lead him, Sam, and you just follow me. So just kind of what you're looking for is where I tap and certain positions I don't stand in, and obviously I want you to be safe as well. So, good to go? Yep. Let's do it.
This is really one of the most dangerous things you can do here. If Elvis was to grab a hold of someone, he's going to take you in the water, he's going to shake your arm off, roll your arm off. Worst case is he grabs you around the torso. You can die.
So we'll get him to swing. I'll probably just tap on this backside of the mandra here. He's not even that worried. Like, I can tap and he's following straight away.
Dan's got to take Elvis to the other side of the pool so that we can bring the food in. Jeez, he's coming fast, Dan.
He's really moving. General feed, he wouldn't move this quick because he knows he's got a big feed coming. He's highly motivated. If he grabbed you and pulled you in the water, it's game over. I've been working with Elvis for a number of years. I always want to be safe. I always want to go home at the end of the day. Now I've got new guys working with me. I want them to be just as safe. Still below the surface, little tap, bring him up. Again, watching his feet, front leg forward, bring him up. You're a bit nervous there, mate.
I've done this a number of times, but my hands are shaking and my heart is beating. How's he looking, Dan?
Yep, he's set, boys, we're good. I'm getting a bit nervous now.
Yeah, me too. That's our chance to grab the beef and bring it in and get it ready to give it to Elvis. Ready, mate? Righto, 1, 2, 3. That's when things can go wrong. So this needs to be a real smooth part of the process. Okay, in.
Yeah, he's on me.
Let's get it up in that corner,
Come
mate.
around, come around.
A little bit more, I reckon, Jake, right where he can't see it. What we don't want is the croc seeing that too early, or us, because we've had it before. He just comes marching out to the corner and grabs it.
Come around that first bend.
When Dan says, righto boys, he's turning, then we move. We've got a rope attached to the meat so that we can give Elvis that reward and stimulation, the big beast he is, of killing prey. But he only eats little bits, and crocs in the wild will go and store that food under a tree or a rock underwater, and we don't want that rotting meat to be a part of his water. So we need a little bit broken off, and then we've got to get the rest out.
All right, boys, he's turning, he's on me.
Righto, go time for us, boys.
Yeah, I got him. He's on that first bend.
Easy up. So, mate, you're on that rope.
Coming round that first
No tangles
bend.
on you, no tangles on us. As it goes, you get ready. Okay, ready, Jake? We'll aim for the mat. Yep. Jacob, give it a little bit of slack. 1, 2, go now. 3. Back, back, back. Hold that rope, mate. Here he comes. He's seen it.
He's
Watch
coming.
out there, Jakey. Now it's go time, and Elvis turns into a freight train. Watch out there.
He's on.
Watch it. He's focused on that meat.
Bang.
Hold him. Oh. Hold him.
Oh.
Let him go, let him go, let him go. Let him go. Take it in. Take it in. We don't want to get it too quick. Whew. Okay, just hold him. Let him settle for a minute. Think he's killed it.
You're right, boys.
Whew. That was good.
Hear that crunch?
Whoop. Oh. Hey, fellas, when this goes, it breaks, he swallows it, we're out, okay?
Oh, it's going to go, boys.
Hold. Oop. Okay, out, meat out. That's a great sign. That's a win. Elvis has grabbed it. But before we get a chance to get the meat out of the yard, he's right up us. It's too quick, boys. Go, go, go.
Go. Bail, bail, bail. Go, 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 go.
Oh. See that?
Yes. Yeah.
Do you feel that?
Just there.
In Bondi, Cocker Spaniel Archie needs urgent surgery after Kate detected something stuck in the sick little dog's intestine. Archie's life will be in serious danger if the blockage isn't removed urgently.
Can I get a kidney dish?
So we're just about to open the body wall. It's going to be very interesting to see what we're going to find in here. It takes us a whole of about 3 minutes to find what the problem is. We found it. It looks like some kind of a tissue. It's soft, irregular, it's all bunched up in there, but we're about to find out what this is. So, yay to going in. I reckon it's a tissue. Oh, it's white.
Yeah.
It's very light. Oh, it's a corn cob.
Oof.
Well done, you guys. There was no way that this was going to get through. If this hadn't have come out today, this dog could have been dead tomorrow.
Archie will be transferred to a 24-hour hospital for overnight observation while he recovers from the invasive surgery.
Good boy. Our part's over, alright, sweet?
It's too quick, boys. Go, go, go. Go.
At the Australian Reptile Park,
Bail, bail, bail.
feeding time for ravenous 5-year-old croc Elvis
Righto, we're back on. Boys, he's got it.
is turning into a deadly game of tug-of-war for Tim and his team.
Everyone right?
It's like, whoa, watch that
tail,
tail,
boys.
Tail.
If Elvis swings that tail around, he could break a leg, dislocate a knee very easily. Even more so, if he knocked one of us over and we fell on top of him, what do you think's going to happen? Let him go.
Don't go in with him.
Clean rope?
Yep. Swing round. You got him.
Ooh, well done, mate. Everyone good?
Yep.
That didn't go to plan.
One.
And now it's round 2. Elvis has got a huge chunk in his mouth at the moment, but their stomach's only the size of a basketball. We want him to feel like he's killed something big and drowned it, but we can't leave that meat in here. That's why it must come out. Jake, swap sides of the rope, please. Whoa. Hold him, boys. Jake, under. He could death roll any time. For a big, territorial, 60-year-old male croc, this is the meaning of life. Here he goes. He's not going to like it. Yep. No, not anymore.
There we go.
As soon as it breaks, you've got to get back, OK? He's going to swallow it and we're out. This has turned into a tug-of-war between a half-ton croc and 4 people. Whoa! Woo. It's starting to break. Yeah, switch. Rook, get up there. Get up there. What's that rope around your leg, boys? Look after the fella in front of you. Don't let him pull you in. Worst thing that can happen now is the rope gets caught around someone's leg, or even worse, is that Elvis does an almighty head shake and one of us go in on top of him.
Big roll.
Tell us when he's building, Jakey. Oh, here we go. Give it everything, boys. One thing's clear, Elvis is not giving up this piece of meat. He's not letting it go until a bit breaks off, and who knows when that'll be. Give it everything.
Yeah, pull him up, boys. Give him a good tug.
We lost it.
Rope out.
The rope pops off. First time that's happened. Normally, we have the rope with the big chunk of meat and Elvis gets the little bit. This time, we get the little bit, he gets the meat. That didn't go to plan again. Who's going to get that out? He's got huge teeth. He's got a ton of downward pressure. There's no way we're going to get that back off him now. This is a dream come true for Elvis. What did we learn today, boys?
Don't let him get you.
Don't let him get you, that's right. And nothing goes to plan. But if you're safe, he's safe, the rest doesn't matter. Righto, well, we've got jobs to do. We'll keep an eye on him. Let's get out of here.
got Jinx for you.
Hello, little man.
Yeah, you can say hi, Jinx, if you want.
Hi, Jinx. Oh, hi, Jinx. Nice, I like it, I like it.
At Scott's Isleworth Clinic in the UK, toy poodle Jinx has just arrived with a very unusual problem. Jinx has too many teeth in his small mouth because his baby teeth simply never fell out.
His mouth is just something that I think I've never seen. So it's going to be quite an interesting procedure today. Hey, we're removing what's called deciduous teeth, so baby teeth. He's a little shy about his mouth, I think, for good reason. Yeah, see how joyful he is about his mouth? Are you going to let me show everyone? Normally they're pushed out by the adult teeth, so you have a baby tooth and you have an adult tooth and it pushes out, and out it comes. And then it's a very natural process, but in his case, none of the teeth have fallen out. Well,
You don't want to show anyone?
you know what we'll do is we'll give him an anaesthetic
Yeah.
so that he's deprived of his shyness about his mouth. Hey. Jinx has the most incredible mouth. I've come across some amazing array of teeth problems in animals over the years, but to see a dog's mouth that looks more like a shark's, it's absolutely insane.
Oh, wow.
It's pretty awesome, isn't it?
Oh, it really is.
And look at that. Sometimes it's the little poodle dogs that you do see, these retained deciduous canines, but this is a pretty extreme version.
That's insane.
The normal process is that a dog's deciduous or baby teeth are pushed out by the adult teeth, but in Jinx's case, this hasn't happened, and right now, he has a mouth full of trouble. Yeah, see, look at that.
Oh, Jinx.
The concern here is there's nothing to force them out. And when you've got something that really shouldn't be there, eventually you'll get infection, you'll get discomfort, and then you get more problems. So at the moment, he's not that bothered by them, but in time he will be if we don't sort them out. So, yeah.
So we got a hectic day today.
Mobile vets Alison and Audrey are heading out of Sydney today to Possumwood Wildlife Sanctuary. The twins are regular volunteers at the sanctuary, which cares for hundreds of sick and injured animals every year.
Hi, Rosemary. How are you?
The girls have been called out by owner Rosemary, who has a new arrival that needs urgent care.
It's a little boy called Joe. But he's got this big swelling in his face. He must be in a lot of pain and, you know, it's very badly infected.
Whoa.
So I'm not quite sure what you're going to find underneath that, but it's not going to be nice.
So this lump is actually under the eye. Oh, that third eyelid is so inflamed from this abscess. So looking at how bad that infection is and the extent of it, that could seed into his blood. And once that happens, he's in really, really bad trouble. He could potentially die from that.
Straight away, Alison checks the inside of the Joey's mouth.
Oh, there's a cavity that goes all the way up in there. I can actually stick my finger in it. And there's so much food in it. Oh, hang on.
And I open that mouth and I have a good look and I can actually see there's this huge cavity going up into that area where the pus is, and my finger can actually go all the way up. So we definitely know it's coming from the mouth.
It's got a loose tooth.
Yeah,
it's a tooth root abscess. So we're looking at two really wobbly, infected premolars, and because they're so wobbly and infected, that pus is accumulated around the roots and into that area under his eye. So I think what's going to happen when I pull this tooth out is all this pus is going to run out. So we're just packing out the back of his throat so it doesn't go down his lungs.
Hey.
Whoa, man. That looks like part of his jawbone's just kind of fractured away with that tooth. The infection must be in the jawbone. So it's pretty smelly and nasty in there. Just in that cavity behind the infected teeth, we can see grass, oats, decaying food there.
Oh, it comes in waves. And what we think may have happened is that the infection is also eating away at that jaw.
Okay, there's still a bit of jawbone up here, but I might have to get it out from here. Oh God, he's going blue. Is he not taking breaths?
Suddenly, the little Joey has stopped breathing.
Can you just give him some pure oxygen? All right, let's do 10 breaths. Close 1, 2, and then open 3. His tongue is still a blue.
Oh my God, the poor cat.
That's really nasty.
At the Lost Dogs home,
Perfect.
Danny and senior vet Sue are preparing to perform surgery on Mo's shattered leg.
So I'm just making an incision over the hip joint. Mo's surgery today, the fact that we've got multiple bone fragments in there and we're a tiny little cat, I think it will be quite challenging. So just trying to feel for where the hip joint is, where the bony fragments are. It's really strange feeling this leg because it's just completely detached from the joint, so it's just floating around. We know we need to do surgery today, but we're also very much aware that there could be complications, including paralysis in that right leg, if there's nerve damage during surgery. So there is a chance that he still may lose that leg. It's not easy visual though, is it?
It's not. It's not an easy visual at all.
It's another level of stress. Oh, hello. Yeah, found it. So that's great. So the next challenge is actually getting in behind the head of the femur that's just sitting there loose in the joint to disconnect the ligament that's holding it snug in there. Oh. So this may not look like much, but that is the head of the femur that's been stuck in the joint and would have been causing so much pain and discomfort with all the fragments there. So fantastic. We've got the first fragment out. Oh, look at that. If that fragment was left there, that would continue to cause soft tissue trauma. If you think of a sharp bone just pressing against all your muscles and soft tissue, it'd be very, very painful. So it's really important that we have a nice smooth surface for that leg to be comfortable in the future. Oh, yes.
Yeah, got it?
Yes.
Yeah.
We thought we'd had all those fragments removed, and of course there is one more, and it's tucked right up high out of our reach. So it's a really challenging fragment to remove.
Oh, it's right there, damn it.
Finally, the stubborn fragment is removed.
See all that blood, vascular. So far there's been 3 separate fragments from this fracture that we've had to remove. So the next step is flushing out this fracture site so we get all the little bits of fragment that we can't manually grab, and then we'll be all ready to close. Okay, I am still concerned about whether there's going to be any nerve damage, and until Mo is recovered and up and about, we're just not going to know how well he can use that leg. So there's still some real concerns for him. He made it all done. Very brave. You're a sweet little man. Messed up. The team at the Lost Dogs home are just very special. The passion that they have for animal welfare and the journey that they have to get to their forever home, it's just incredible. I feel like I'm finally doing what I trained for. Thanks very much. See you, mate.
It's pretty awesome, isn't it?
Oh, it really is.
And look at that.
That's insane.
In the UK, Scott's patient Jinx is about to undergo an unusual dental procedure.
So these are kind of normal, the kind of spare canine, because that would normally push that one out. So that's just malocclusion, so they just haven't aligned properly to push the adult out. So we see that quite a bit. But so that's on both sides, but it's the ones there.
Yeah.
That's incredible to see. You can see that's in front of that, you see.
Wow.
And then these are all in front of those. So
There's tiny little ones at the front.
yeah. So all of those need to come out, my friend, don't they? As a result, you get a huge amount of food being accumulated around them. So it does mean sore gums and rather pongy breath.
Jinx has double rows of teeth because his baby teeth never fell out when the adult ones grew. The challenge for Scott will be working out which are the baby teeth and which are the adult ones.
The adult teeth are quite small. The baby teeth are quite large and quite numerous. And there is some change to the way that they have erupted because the baby ones are pushing the adult ones. So they're settling in a slightly strange way. So I just need to take my time and make sure I remove the right ones. Okay, so I'm just going to start with the canine on this side. Okay, so that's one. There you go, that's another one. One of the challenges of removing teeth, particularly canines, in pets is that they have really long roots, and when you are trying to remove them, sometimes the worst case scenario can be you can break their jaw. Another one.
The surgery is extra tricky because of the confined space in which all the teeth have had to grow.
That one and that one, I actually think are adult teeth that have been pushed out. So these ones are abnormal. That's fine. That's all right, and we'll just get to the other side. Okay, so let's have a look now, and then we'll just see what that looks like. So, well, that looks more normal. It's back to looking like a dog.
It's been a marathon surgery, and Scott is making sure he hasn't missed any of the excess teeth.
So what we have here now is a dog with all 42 teeth, 42 permanent adult teeth that he should have. They are in slightly odd positioning, some of them. And now he's missing 1, 2, 3, 4, 5, 6, 7, 8 baby teeth. So now he's all good. All these gums will heal very, very quickly. They're very well perfused with blood, so they'll heal real quick. And he now is just a dog, no longer a shark. All right, so we can wake this guy up. That's a way to get the tooth fairy excited. Look at that. Well, hey, come and get it. It's okay. You're a good boy. With Auntie Catherine. There you go.
Come on. Oh.
Right.
Good boy.
A very drowsy Jinx will now be left to have a big sleep.
Good boy.
Oh, man. That looks like part of his jawbone just kind of fractured away.
At the Possumwood Wildlife Sanctuary, twins Alison and Audrey are in the middle of treating a joey with a shocking tooth abscess.
Oh God, he's going blue. Is he not taking breaths?
All of a sudden, the joey has stopped breathing.
Can you just give him some pure oxygen, please? All right, let's do 10 breaths. Oh yeah, he's going pink now.
It's a huge relief as Joe the joey starts breathing again. And now the twins can start cleaning out the massive infection in his jawbone.
Oh, the pus is coming out the eye now. We're going to just try and lance the abscess from the outside.
I'm just putting my finger through the root area where we removed that tooth, and I can feel a piece of bone that we need to get out there. So if I sort of hold the eyeball away and then you cut in a ventral motion downwards, so that way. Okay, ready?
Yep. Just move your finger.
That's it. Get ready for the smell.
Oh, it's strong. Oh.
Oh, there's so much pus coming out there.
Oh, that's a lot.
I think possibly he fractured his jaw. Upper jaw.
With the abscess now completely drained, the girls want to x-ray Joe's jawbone to get a clearer picture of the damage that may have been caused by the shocking infection.
Be interesting to see exactly what part and how much he's lost. So that's the top jaw here, that's the soft tissue swelling where the abscess was. That's where we removed the 2 teeth. You can see there's some bone loss here, so that's where it's all started.
So just having a look at that x-ray, we can see the area of the jaw that's actually come away with the tooth. And I think there's probably some sort of traumatic injury, hit by a car, where that's really fractured that bone and then caused all this secondary infection. So lucky little man to make it today, and I'm sure he's feeling a lot better with all that pus and discharge out of his face.
It's been a massive surgery for little Joe, and he'll now be left to sleep off the anaesthetic.
Nice and warm.
Hi Audrey Allison, here we go, here's Joe.
24 hours later, the twins are anxious to check on Joe and discover whether he'll be one of Possumwood's survivors.
Oh, look at that.
That third eyelid has retracted all the way back and it's no longer red and angry, so that's a huge improvement.
Yeah, you can see that pressure's really off the eyeball now that he can close that eye.
There's no damage there, which is great.
I'm just going to have a look in your mouth, babe. Let's have a look. Definitely smells a lot better.
Yeah. So we're really happy with Joe's recovery. He's done really well overnight.
Hey, can you see us a bit better now? Still a little bit groggy from the sedation, so we'll bring him to bed, and once he's recovered, I'm pretty sure he's going to be bouncing around in no time. Doing very well.
And what a change in Archie after he underwent life-saving surgery to remove a corn cob blocking his intestine.
His recovery has been really great. He had to wear a 1C for quite a few days, which he wasn't that happy about, and he's been healing really well and he's back to his normal self again.
Oh, there he is.
Carolyn was terrified of losing her little man, but now she can breathe a sigh of relief.
I don't even know where he got that corn cob from. I don't even eat corn.
What's your toy? You're such a big baby.
He is just always there. He's my best wingman and I just love him to death, yeah.
Look at you.
In the UK...
Are you ready to go and see Daddy? Hey?
It's 2 hours after Jinx's marathon surgery and he's ready to be reunited with his owner.
There he is! How are you? There he is, there's Daddy! Look at him!
Oh, that's nice. That's the most animated he's been all day. He's such a good boy, but wow, what a set of gnashes.
Yeah.
Let me show you a picture on my phone. So look, that's his mouth there.
Wow.
I mean, look, two proper sets. So it's just...
That's the best look I've had in there, wow.
Yeah, it's amazing, isn't it?
Yeah.
All right, take this little dressing off when you get home. Just slide that off. That's just where his IV went in. And then he's got some anti-inflammatories for you as well.
Okay.
All right, see you later. Bye. Bye, Jinxie. Bye.
Hello.
Hi, Danny.
Nice to meet
Nice
you.
to meet you too.
I'm so excited to see Mo today.
I'm always in the couch.
Let's come have a look.
I'm here.
It's great news for Danny's patient Mo. After recovering well from his leg surgery, the brave little stray has been adopted into a loving new home.
I wanted to thank you for doing so much good things for Mo.
Pleasure. He's just such a special little man. One of the most stoic cats I've ever met. So thank you so much for adopting him.
I'm very much happy to be his owner.
Hey Patrice, can you give me a hand with this girl?
On the Gold Coast, Alex is about to examine 1-year-old puppy Luna, who's been rushed into emergency after being hit by a car.
She's definitely in a degree of shock. I've given her some pain relief, but let's get her on some oxygen. Poor girl. And I just want to check out her wounds because she looks like she's got some pretty nasty injuries.
Owners Hope and Liam are devastated at what's happened to their precious girl.
We accidentally left the side door open and I heard a car. I heard the car and I just felt like something was wrong and ran around looking for Luna and couldn't find her, so I went out the front and then she was just hobbling over to me. Her front paw was all floppy, pretty devastating.
All right, let's see what's going on. I'm just going to go nice and slowly. I'm just going to start at the back.
Good girl.
Good girl.
Good girl.
It doesn't move back here.
Oh, darling. Yeah. I can see underneath here she's got wounds. She's been dragged. Oh, yeah, and on her belly too. Oh, she looks like she's got grazing all along her tummy. That would be so painful. Of course, we don't even know what her internal injuries are.
With hit by car patients, you become extremely concerned about injuries like internal bleeding and head trauma. But I can already see she's got significant external injuries.
Oh, look at this, she's even got little wounds on her head. She's literally must have just tumbled along the ground. I'm going to touch anyone that hurts too much. I'd be pretty worried with the amount of her injuries. Hey? Good girl. I'm just going to have a listen to her chest. It's such a sweet. It's okay. Chest sounds okay.
I know.
Yeah, I think we're definitely going to have to do some x-rays. Okay. See how bad the damage is, but she's only a little dog, and if the car hit her at speed...
Maybe some damage back there.
Yeah.
All right, well, shall I get her set up and...
Yeah, if you can pop her in a bed.
Yeah.
Okay, I'll come back and see you, all right, sweetheart? I'm going to fix you up.
Okay, I'll be there soon.
Today, Alison is heading outside Brisbane to a camel farm and one of the biggest challenges she's ever faced.
I've just received an SOS from Margie. She's asked me to come urgently to the camel farm. So I'm excited to be there again, but a little bit worried. What are we dealing with?
Let's do this.
Alison has had limited experience with camels, so helping vet Margie is going to be a massive learning curve.
Margie, it's massive. Humongous. How are we going to get it back in?
It's not great.
When I arrived, Janet's lying on her side and her entire uterus is actually outside her body on the ground. So it's extremely shocking to see this. Not only is she in pain, she's very weak at this point. Is it still going to be viable? If we can't get this uterus back inside, Janet will die.
So what we've got to do is I've got to tie some ropes. Hey, girls.
As other farm staff arrive to help, Alison and Margie must find a way to reinsert the new mum's prolapsed uterus before it's too late.
We'll tie the front legs because we can't get her to stand up because it'll cause too much trauma if she stands on that uterus. Poor Janet is in such a bad state at the moment. It's the entire bag that the baby has come in has now come outside her body. It's a true life and death emergency. We have to just improvise and make the best of this bad situation.
Close by, Janet's newborn daughter is also struggling to survive without her mum.
So what we've got to do is make a little makeshift operating theatre.
Oh, poor thing.
Hello, sister girl. Hey. No, Bubba. Bubba. Oh. Bubba. Janet is in a huge amount of distress. She's lost a lot of fluid in the birthing process. She's also going into shock and a lot of her body systems have shut down. Chill, 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 chill.
Hey, Jed. You healing up okay, babe?
In Melbourne, it's a special day for Danny. She's working at the Cat Protection Society.
Oh, hi, my sweet girl. Look at you.
And she loves seeing familiar faces like little Buffy.
You're looking so much better, aren't you, hey? You've put on some weight. Looking fit as a fiddle. Hey, I think you're going to be ready for your forever home now. It's so nice being back at the Cat Protection Society, seeing some of the patients I've been working with and seeing them more on the mend. It's really nice. Hey? Oh, you are, I know. Buffy is looking fantastic. It's so nice to see her doing well. I'm so excited for her future. You darling.
Buffy has a clean bill of health and is ready for adoption.
Oh, hi Lisa, how you going?
Good, thanks, Danny.
But now shelter manager Lisa has a very special new arrival who desperately needs Danny's help.
I do have a special needs boy that I would love you to have a look at. His name's Edgar.
Oh, Edgar.
And
Let's
he's
go
gorgeous.
meet Edgar.
Let's go. So Edgar was brought in by a member of the public and came from a colony of cats from a factory area that this gentleman had been feeding very kindly. But of course, it was getting beyond control.
Are you sweet?
Brave little Edgar was in a shocking state when he arrived at the shelter.
Hi, darling boy.
But it's his eye that now needs the most urgent attention.
It just hasn't healed properly, even on antibiotics, so we really need to have it assessed to see where we go in the future with that, so it's not going to be a problem for Edgar.
All right, mate, let's have a little look at that eye, darling. Hey? Oh, gosh, sweetheart, ouch.
Yeah, it's not great, is it?
That is a very diseased eye. Edgar has had such a rough time. He's been on the streets, he's malnourished, he's had infections that have been causing him itch, discomfort, pain with his ringworm and his eye since probably he was born without any treatment. The poor thing, I wouldn't wish that upon any animal ever. Oh gosh, yeah.
So would this be causing him pain?
The fact that he is squinting, he's got that blepharospasm, that absolutely implies there's pain. Oh mate, that is just awful, you poor thing.
She's leaning into it. Come on, Bubby, this way.
At a camel farm outside Brisbane, Alison and fellow vet Margie are racing to save the life of a new mum after she gave birth overnight.
Poor baby, I know that hurts.
As her new calf was born, Janet's uterus was dragged out of her body. She's now gone into shock and her blood pressure is critically low.
So a prolapsed uterus is actually where the uterus inverts, almost like a sock turning inside out and coming outside of the body. Janet's calf looks massive. And that probably explains why the labour was quite difficult.
All right, let's get some IV fluids set up. This is something Alison can absolutely nail. If Janet was in the wild giving birth, both animals would definitely be dead within 6 hours. This is a true veterinary emergency. If we don't treat Janet right now, she will 100% die. And if Janet dies, then the calf has no hope. Just watch your foot.
Oh my gosh.
The most urgent need is to replace the enormous amount of fluid Janet lost during the traumatic birth.
Have you ever heard the term hook a brother up? Okay.
Working in a remote paddock, the team has to think outside the square.
Wow, look at this setup. Margie's really impressing me. She's come up with an ingenious plan to get the bag of IV fluids above her head level so she can slowly infuse those essential fluids into Janet's system. So she gets the farm buggy out, and that's just genius.
I just need her head to stay in this position. You can pop that catheter in, so you go that way. So out here, we've got so many more things to deal with than, say, if we were in the clinic. I have to improvise, I have to think something up, I have to MacGyver my way through the situation. So I'll just hook this IV up, so she's got some IV fluids.
Massive, that wrap.
Get up through here. So there you can see we've got the fluids running in really quickly. We're going to need to replace at least 10 to 20 litres of fluid over the next hour or so to have any chance for her survival.
With Janet sedated and life-saving fluids now flowing through her veins, Alison and Margie focus on how to get the prolapsed uterus back inside the ailing camel.
So what we're looking at is the inner lining of her uterus, right? Yeah. It looks disastrous, but if we clean it up, it's not ideal, but the body will expel anything dirty.
Yeah. Yeah.
So that will go in. We are up against time on this one. We've only got a couple of hours to replace Janet's fluids. We've only got another few hours on top of that to actually replace the uterus. Then we've only got a couple of hours to make sure the baby gets what she needs as well. The clock is well and truly ticking. Easy, easy.
Oh gosh, yeah. Oh mate, that is just awful, you poor thing.
At Melbourne's Cat Protection Society, Danny and shelter manager Lisa need to find out if Edgar has any vision in his painful left eye.
So it's got the third eyelid right over the cornea there, but what I can see, the cornea looks just really irregular. and scarred. All right, mate, so we're just gonna check essentially that there's no vision in that eye. So we're just gonna do a menace response test.
Yep.
So the fact that he is just not responding to that menace test, it just confirms that there's no vision in that eye. But unfortunately, a painful eye that I believe would have no vision, there's really only one treatment option for that, and that's going to be to remove that eye. You're sorry, mate.
Well, whatever's best for Edgar.
The surgery to remove an eye, it's not something I want to go and do, but the one thing that gives me comfort is that I know Edgar's going to feel so much better with it gone.
I'm leaving with you.
All right, we'll
I'll
go
come
get
and
you
check
all
on him
cozy.
later.
Okay, my darling. You come with me, sweetie pie. Here we go, Papa.
If Edgar doesn't have surgery, his diseased eye will become increasingly painful and he'll have little chance of finding a new home.
Good boy.
The special ones, like Edgar, that we just need to go that extra mile for and get into that home that, we know he deserves, and to the life that he should have as a cat, just lazing around and sleeping 16 to 18 hours a day.
First step of this procedure is essentially just to suture the eyelids closed, keeps everything confined into that area, and it also gives us a point of leverage to navigate the rest of the surgery.
The surgery is extremely risky.
This is definitely the tricky bit.
The vital optic nerves cross over between both eyes, and the slightest damage could mean Edgar risking losing his sight completely.
It would be absolutely devastating if I were to damage the vision of the one eye that will be remaining from this surgery. That would be just horrendous. So we've made good progress through the tissues.
Every year, around 2,000 strays and abandoned cats just like Edgar are treated at the shelter.
Yeah, I'm scared I'm getting into the globe.
It's hoped that with the right veterinary care and loads of TLC, every one of them can find a loving new home.
All right, so we've just released all the tissues from behind the eye, cut through the optic nerve. I'm just removing that eye now.
The delicate surgery is complete, but Danny is anxious for what the future holds for little Edgar.
Overall, I'm really happy with how the surgery's gone. I think everything's been fairly uncomplicated, which is great. So it's just a matter of seeing how he recovers and making sure there's not been any damage to the vision of that other eye.
Edgar will have a big sleep, followed by plenty of extra TLC.
She's not even stable enough to undergo an anaesthetic.
On the Gold Coast, Alex is assessing little Luna's shocking injuries after the 12-month-old puppy was hit and then dragged by a car.
I'm just giving Luna some fentanyl now, which is a very strong form of pain relief. She's got some severe injuries there. We don't really know the full extent of it, but any dog that's come into contact with a car with the injuries that she's showing at the moment has got to be in a lot of pain. We're going to bandage Luna's wounds to prevent any further contamination, and also it'll make her more comfortable.
Luna's devastated owners are anxiously waiting for news.
I've organised for Hope and Liam to come through and see Luna. It's been a very distressing time for everyone. It's important that they have a chance to see her.
Lie down, lie down, lie down.
If Luna was my dog, I'd want the chance to give her a cuddle. Okay, she's just down here. Okay, you all right? Hey Luna, look who's here. Look who's here. Oh, sweetheart. Oh. Okay, that's all right. Pop you away, good girl. It's okay, you see them soon, sweetheart. Know what some of Luna's injuries are, but I am starting to get worried about that left front leg, which she doesn't want to use, and she keeps holding it up. And if it's broken, we'll be able to see on the x-ray. But sometimes the injuries that we can't see can be worse than the ones that we can. I'm really worried about you, sweetheart. Hey, what have you done? What have you done, hey?
Easy, easy.
Alison and fellow vet Margie are racing against time to save Janet, whose uterus came out of her body during childbirth.
That's it. Just check that uterus is still in a good place. The case that we have here today is one of the most difficult jobs you have to do as a mixed practice veterinarian. We've literally got 20 or 30 minutes before Janet goes into complete shock. We've probably got 2 hours before we lose Janet entirely. Good job.
Janet is extremely weak and will die unless the team can reinsert the prolapsed uterus. Without an epidural, she won't survive the extremely rare procedure.
We're going to put local anaesthetic into the space around her spinal cord and Janet won't feel a thing. It also helps with contractions. We're trying to put this giant organ back in and we don't want her to push it out. This is impossible to do without an epidural.
Uterine prolapse in general is bad. If you imagine a sock being pulled inside out, that's actually the inside of the uterus that we're seeing. So to manipulate that back in is going to be quite tricky.
Yeah. It's about 50 kilos.
This bit is the...
And this is twisted.
But after disinfecting the uterus for reinsertion, a new danger threatens the already risky procedure.
Oh, Bobby. So I've just found worst case scenario for Janet. She has a tear in her uterus. If this tear gets any larger, this whole process is for nothing. Janet will absolutely die.
With the tear repaired, everyone is desperately hoping the stitches will hold as the arduous task of reinserting Janet's uterus begins.
Okay, so I've got her uterus resting on my legs.
Not wrong, this is heavy uterus.
Pushing it.
It's about 60 kilos of weight that we have to support and gently manipulate inside. And Margie does warn me that this is going to be a lot of physical work. This is extremely different to small animals that are on the operating table, definitely out of my comfort zone.
Okay, up. We have so many problems to deal with today. One of the biggest is that Janet will get worried, will want to go and feed her calf, and that she'll actually stand up and damage her uterus by actually standing on the uterus. She could rupture the uterus, and that is instant disaster. It's a constantly evolving process. No, baby, no, baby, no, baby. Easy, easy.
Hi guys. So this is Jackson.
Hi Jackson.
In the UK, it's Scott St Margaret's practice.
Laura, the question is, what do you think the problem is? Man, that is gross.
Tom has brought in 2-year-old Jackson, who has a rather unpleasant problem.
Well, it's a bit of a smell coming from this end.
Yeah.
Jackson's had an infection in the mouth for a long time, for it must be 8 or 9 months, and tried all different types of antibiotics, which unfortunately didn't work. And it was kicking out quite a bad smell, actually, which wasn't very pleasant.
It's probably one of the only times in this pandemic I'm glad that we're always wearing masks. So Dad's describing the smell at the moment as 3 out of 10.
Oh wow, so this is mild.
This is mild. He says when it gets to over 5, whenever the dog's in a car, they have to open all the windows.
He has 2 very deep facial folds that are right in his mandible, in his jaw, and they harbour some pretty nasty bacteria, which leads to very sore skin, but also a very strong and not very nice smell.
It's really quite pungent.
And he's had a really tough time, haven't you?
He's had cancer, and then went through chemotherapy, got another lump, which we thought might have been cancer again, so had that removed. So yeah, it's been pretty bad.
Strangely with Jackson, he started to have more of a problem with his facial folds after his chemotherapy treatment. Now, whether it's messed with the natural bacterial flora of the skin, I don't know, but now he's getting infection, he's getting inflammation of these folds that's actually causing him discomfort.
Good boy.
I just hope that he's going to be, you know, pain-free after being in quite a lot of pain for a while.
Scott plans to clip away the fur around Jackson's mouth so he can assess just how deep the infection is. He also needs to work out how much of the skin folds he's able to remove to stop the problem from reoccurring.
Man, that is gross.
Get you some more pain relief before we even move you. Yeah, I think you're going to be too painful to move like that.
Back on the Gold Coast, Alex urgently needs to x-ray Luna, who's been hit by a car. But with shocking injuries, the puppy is in too much pain to be moved.
Luna's more painful now than when she came in. Often what happens is when they first get hit, their adrenaline's going and they're not feeling the pain so badly. She's been here for a little while now and I think it's really starting to kick in. So we want to take her through to x-ray, but I think before we even move her, we need to give her some more pain relief because she's really uncomfortable. Good girl. There she goes. Okay. There we go. That's better. Okay, let's go. Good girl. Good girl. All right, sweetheart. I take the first set of x-rays off her chest. I'm looking for collapsed lungs, broken ribs. The chest actually doesn't look too bad. So there's no collapsed lung there I can see. Let's take the other side and have a look, but that's not as bad as I thought actually on her chest. Next, we're going to x-ray her pelvis and her limbs. We're looking for fractures and dislocations. Okay, let's drop her the other way. That looks pretty good from that angle. Luna's pelvis is intact and doesn't appear to be damaged. That's good news. Okay, let's look at this front leg. Oh, let's see what's going on in there. Okay, moment of truth. Let's see. Oh, wow. No. Oh, that's a nasty fracture. Look at that.
She's not putting any weight on it.
No, that's... Oh. We take the x-ray and it's quite shocking. The leg is shattered. She's got a completely free fragment there as well. That's a really nasty fracture.
In Melbourne, it's been 2 months since Edgar had surgery to remove his eye, and the future looks bright for the brave little cat, now affectionately known as Gar, after being adopted into a loving new home.
Gar is an absolutely gorgeous little cat. It doesn't matter if he's got one eye, two eyes, no eyes. He's just absolutely gorgeous. And he's got such a lovely personality. He's so sweet. Oh, what was that?
Nina and her son Andrew had an immediate connection with the lively rescue cat.
We felt a little bit of kinship with him because our son's legally blind. And we thought, well, we can definitely deal with a cat who's got a vision problem. There's absolutely no problems with that.
Good boy. One of the reasons we adopted Gar was because I've grown up with a vision impairment my whole life. We have a bit of an understanding of sight impairment and what that involves, what that includes, and therefore how to kind of approach it. Gar's favourite toy, he loves his bottle caps. He's got other toys, but the bottle cap always, because he can play with it by himself. Yeah, he's just a good cat. That's all he is. He's a good, loving, friendly cat. Gar has become a new friend for the family.
No, this is a real representation of trying to get back a text.
Hashtag
that you regret sending.
Outside Brisbane, Alison and Margie are still struggling to reinsert Janet's prolapsed uterus.
That's it, that's okay. Stop straining, Bubba. Easy, easy, easy.
I'm extremely worried for Janet. There is a lot of issues going on. And at this stage, I don't even know we're going to get the uterus back inside.
That's it. It's helpful. It's not all just about getting the uterus back in perfectly and providing her with antibiotics. The problem is that once the uterus is back in, the weight of the uterus can actually rupture the middle uterine artery. If that ruptures, Janet will bleed out within 25 to 30 minutes.
Getting up!
Oxytocin! The reason she's straining isn't because she's feeling it, because her calf's here. She's probably feeling everything and nothing all at one time. She knows she's given birth, she knows her calf is alive, she can't get up, she can't attend to the calf, and she doesn't know why. That's it. Okay, good.
Oh, yeah. Yep, it's going.
Good girl. We're definitely getting there.
Finally, after almost 3 hours of fighting to save Janet,
Yep. Straight.
Margie and Alison complete the life-saving operation.
Good work, team. So we've done well.
It is such a relief when we finally finish operating on Janet.
No, Bobby.
Alison and Margie are exhausted, but now they must turn their attention to Janet's newborn calf.
Hello.
Hey, baby.
Hi.
You are massive.
A very, very big calf, Alison, and I think that's why Mum might have had some struggles.
Like her mum, Janet's newborn daughter is also in a race against time.
We might call her Alison. What do you think?
Called Allie? Alison?
Alison?
Not so little Allie is actually really gorgeous. She's a beautiful colour, but she's actually in quite a lot of risk. That first milk that a calf takes is very, very important. If Allie hasn't had that first milk, she's at risk of passing away.
Yeah.
Well, it's a bit of a smell coming from this end. What an image.
That is gross.
At Scott's St Margaret's practice, cancer survivor Jackson needs more surgery, this time to remove deep facial skin folds that are constantly infected and smell terrible.
It's just below the gum, so the gum line's there and then the fur is here, and it's sort of just between the two.
On his lip.
Yeah, he's got this just really deep fold. Because there's two options. I've either can take tissue out from the centre, which would then do that. But what you're left with is quite diseased tissue. So there's also an argument to actually remove the diseased tissue and get the tension from there.
And lift up.
Okay, I think what we'll do is we'll just clip the whole area, the whole chin, and then we'll just see if it looks any different that way. It's making my eyes water. It's nasty.
Scott's hoping Jackson will have enough loose skin so the deep infected folds can be removed and then the edges sewn together, leaving his face smooth and odour-free.
Now I've got Jackson on the table and I can clearly see the abnormal tissue that I need to remove. Sometimes in the course of doing surgery on animals, we have to remove large amounts of tissue. And the concern is there's only a certain amount of skin covering an animal. And we have to be very careful that we don't remove too much. We have to try and make it not only work medically, but also cosmetically, which is the challenge. Here's one side of the Stinky Canyon. Well, yeah, when you look at that deficit, you go, wow, that's a big hole. So this ends up being about the same size as the other side, maybe a little bit smaller. That. Pretty satisfied with that. Looks good. Looks good, smells good. That's rough enough.
mate. It's okay. Come on then.
A new-look Jackson will sleep off his anaesthetic for a few hours before going home.
You're a good boy. You've been through a lot, haven't you?
All right, let's get you sorted, little one.
Can we get you to sit down?
You are massive.
Alison and Margie are preparing to do blood tests on newborn camel Ali to see if she's had the crucial first drink of her mother's milk.
It's incredible to think that she was only born 5 hours ago. For our little calf, there's a really small window where that all-important mother's milk is actually able to be absorbed across the stomach lining. This is a really high-risk time for Janet's newborn baby. Here we go.
I know, Bubba.
So what we'll do is we'll take that up to the lab.
While her mum Janet recovers from her near-fatal surgery, Ali's blood tests will show how much danger her young life is in.
After all the work we have done on Janet, we are going to do absolutely everything we can to help this little baby fight for its life.
Oh, that doesn't look very good, Margie. Do you want to take a look?
Okay, let's see. So we're looking at the number.
The test reveals Ali's protein levels are dangerously low. She urgently needs a life-saving plasma transfusion.
So the first 6 hours of a calf's life are some of the most important in their entire life. That mother needs to stand up and provide that first milk that contains all the immune proteins, all the antibodies. If the calf doesn't get that colostrum in that first 6 to 12 hours, the calf has next to no future. Alison's got the catheter in. I'm just priming this plasma infusion.
So the blood tests indicate that Ali did not get that first milk. If she doesn't get this essential plasma, she may die.
As well as life-saving plasma, Alison gives her namesake milk they've just expressed from her mum, who's too weak to feed her newborn.
Here we go.
Let's just swap that out for her.
That's it. So while Mum's having a break, this is Dr. Alison feeding Alison.
Oh, I'm just being Mum. So I'm giving Ali a bottle of warm milk, and it's just the best and most rewarding feeling to see her drinking, and it's good to know that she's going to be okay.
You had enough?
Mwah. I'm not going to kiss that now, it's all slobbery.
Real sticky. Sticky bicky.
Wanna go up there with the others? Go up with the others.
It's been an extremely tough day, both physically and emotionally, but it's really rewarding to know that we've done some good today. That little Ali is going to continue to thrive, and Janet's going to be a loving mother. Look at those legs, they're so long.
All right, now she's up and raring to go. The circle of life never ceases to amaze me. Bye, Ali.
Bye, Ali.
See you soon. Oh, wow.
On the Gold Coast, Alex has just x-rayed car accident victim Luna and is shocked at her injuries.
Oh.
The little dog's front leg is shattered.
That's a nasty fracture.
Look at that. She's not putting any weight on it.
No, that's... Oh.
Luna's humerus, which is the bone that goes between her shoulder and her elbow, is in 3 pieces. It's a devastating injury, but as an emergency clinician, you need to keep moving forward. You can't get caught up on one thing. We need to do a fast scan. The purpose of a fast scan, it's a trauma scan, essentially. So what we're looking for with Luna is any free fluid in her belly. If there's fluid there, it's going to be either blood, so internal bleeding, or she could have ruptured her bladder or ruptured her gallbladder. We're not looking at organ structure here, we're just looking for fluid. And I can see there that her bladder's intact, which is good. Okay, so I'm just looking at her kidney, looking for any fluid around there at the moment. I'm not seeing any, that's good. She's still in trouble, but not as much trouble as she might have been if she'd ruptured her spleen or her liver or anything like that. I know that Luna won't go for surgery for another day or so. Her contusions need to heal and there's swelling there that needs to resolve. Let's go. All right, darling. Okay, all right, let's sort your wounds out. So the plan for tonight is really going to be to clip and clean these wounds. They're heavily contaminated. There's literally bits of road in her wounds. So we need to clean as much as possible, bandage them. Some of this skin may also die off. So we need to wait and see what's going to survive and what's going to die. Poor girl, I think she's going to be in hospital for quite a while. Tomorrow she'll be transferred for the repair of her fracture and then the ongoing treatment of her other injuries. She's a beautiful dog with a wonderful family who love her dearly, so we're going to do everything we can to get her home. I got that leg. Hey, sweetie. I'll leave you to rest for the night, hey? Good girl. You're a little fighter, aren't you? You hang in there.
You smell lovely, eh? You smell lovely.
In the UK, it's time for tough little battler Jackson to head home with relieved owner Tom.
You just smell like a dog now. Yes, yes, yes.
They've done a little sort of cosmetic surgery on him to try and fix it, basically. Hopefully it's worked.
Poor Jackson has had such a tough time battling and beating cancer. It's so good to report this surgery has gone well. He looks great, and better still, that awful smell from his skin folds has gone.
Hey, should we go see Daddy? Hey, come on. Let's go see Daddy. Let's go. Come on, Daddy. Good boy.
Here he is.
Hello.
Hello. Say hi, Dad. Yes. Oh.
The first thing you get is not what he looks like, but he smells.
Yes.
So much better.
Yes.
So I'm just going to lift him up like this,
Yeah,
and hopefully you can see just under his chin there.
Oh yeah.
So he's basically got 2 incisions on either side, haven't you, mate? Yeah. So yeah, there was really sort of 2 canyons of bacteria and pus and hair. And I was saying with my colleagues that, you know, today was a 3 out of 10 day. Goodness me, I wouldn't want to be in your house on a 10 out of 10 day.
You would have had to know outside if it was a 10 out of 10 day.
That's the thing, is now, Thomas, you have no excuses, my friend. You can't blame it on the dog anymore.
No more blaming it on the dog.
Big-hearted Tom absolutely adores Jackson, even with that terrible smell. But it's great to have these best mates reunited, and hopefully they can now look forward to a healthy, odour-free life ahead. You look. Try to taste the ball? Is that for you?
There you go.
Come on then, get out of here while you still can. I don't always give my patients treats as they walk out the door. The fact that we have performed surgery 4 times on poor Jackson in a very short space of time, if anyone deserved a tennis ball, it was him. Jackson, see you, buddy. Ah, very cute.
The day after Luna was struck by a car, she was discharged from the emergency hospital to undergo surgery. Unfortunately, Luna's badly injured leg wasn't able to be saved. However, she did recover from her other injuries and is now doing extremely well.
Her calf will be around somewhere. Oh, hello.
A month after their life-saving battle to save camels Janet and Ali, Alison and Margie are back to check on the miracle mum and daughter.
See, this one's... Yeah, this one's actually dripping a little bit of milk here.
Yeah.
It's the end of the birthing season, and while both are doing well, there have been another 12 new arrivals since Ali was born.
I'm extremely excited that Margie has invited me back to witness the beginning of a new camel life.